Hello everyone and welcome to Norwich University of the Arts. My name is Simon Wilmoth. I'm Professor of Research Management at the university, and our online symposium today is Arts and Mental Health Facing the Future. This subject reflects a number of research projects at Norwich University of the Arts, but particularly a project at Northside House, a mental health unit in Norwich that we are proud to be in partnership with Hospital Rooms and the Norfolk and Suffolk NHS Foundation Trust. I hope that you've all received the programme and the delegate pack. There is a link in the delegate pack to an online exhibition related to the project at Northside House. It's on the Kunstmatrix site that some speakers will be referring to and that you may wish to visit during the break or after the symposium. As you will have seen, we have a very rich programme for you today with a number of distinguished external speakers as well as colleagues and partners to bring a range of perspectives to our understanding, experience and consideration of the relationship between arts and mental health. A couple of small points of housekeeping I'd like to mention. If you have a question for the speakers today, please ask it in the Q&A section of your Zoom screen. I will monitor your questions and then ask them on your behalf in the discussion panels that we have scheduled. The chat function is disabled today, so as a delegate you can't use that. So please also use the Q&A section if you wish to make an observation rather than ask a question. Our first keynote speaker today is David Cutler, Director of the Bearing Foundation, whose paper is Mapping Creative Opportunities for People with Mental Health Problems. Thank you, David.
Many thanks for inviting me to speak today. My name is David Cutler and I'm Director of the Bearing Foundation. I felt both delighted and honoured to be invited to talk a little bit about our mapping work on creative opportunities for people living with mental health problems. I wanted to start off by sharing two emotions with you. The first one is an almost indescribable sense of relief that after about 30 seconds, the technology's still working. So I'm hoping that carries on. And I think already is a vote of confidence in the organisers. And the second is a pretty strong sense of imposter syndrome. I'm really acutely aware of my limitations as a commentator on this very, very important issue. I know that you've got a tremendous symposium. You've got contributions from artists working in this area, from people with lived experience and with academics, and also academics who are artists and all variations. So I think they will make up for a number of my limitations. I'm going to speak for about 20 minutes or so about a report that you'll find on our website and probably links in your papers called Creatively Minded. And I wanted to start off by just giving you a summary, three very important points I'd like to make from that report. And the first one is, if you have a moment, the thing to read is the foreword. The foreword is by a woman who's now a local artist working in Norfolk. Her name is Dolly Sen. She's a woman whose practice is shaped by her experience of mental health problems. And she writes quite brilliantly in a short foreword about the importance of this field. I tried to do a few quotations not long ago from Dolly's work, and I realized that every sentence is quotable, every sentence is powerful. So please go to that foreword to our document. And then 2 points that I think summarize what we found in Creatively Minded. The first is that creative opportunities and arts and mental health in my view, lie at an important intersection. And that's what is a major reason for its dynamism and significance. It's an intersection of creativity, well-being, and of activism. And each of those strands, each of those elements brings different motivations and different dynamics. And with that, my last point in summary comes tremendous complexity. I think it's complexity in every direction that you look. It's complexity of motivation, as I've just said. It's complexity because of intersectionality, the many different aspects of personality and lived experience. It's complexity in the breadth and contested nature of mental health itself, where everything about mental health and diagnosis, I think, is up for debate and up for question, and with tremendously strong views in different directions. And it's complex in terms of providers of those creative opportunities. So in our report, we refer to 170. In a later report, we refer to 250 organisations in the UK, almost all of which are arts organisations, where this is an important element, or often the sole concern for the organisation. And of course, it doesn't stop there. That's mainly arts organisations, but there's also individual artists, freelance artists, mental health charities such as Mind, recovery colleges, parts of the NHS, tremendous degree of variety and complexity. The next thing I'd like to mention is that I'm very aware that language is important, but also difficult when it comes to exploring these issues. I'm going to be using the phrase mental health problem, but I'm very aware that there are many different descriptions that people use, that there are strongly held preferences, whether it's talking about a mental health issue or whether it's talking about mental health distress. I don't believe there is a consensus around language. And for the sake of, we have to use words though, and for the sake of the report, we came down on mental health problem, which is the phrase most commonly used, I think, particularly, for instance, by Mind. But it's certainly the case that the whole gamut of descriptions of mental health are questioned, and including the very concept of diagnosis and also of recovery. These are all controversial areas. And slightly less controversial, but only just slightly less, is talking about the arts. We would, at the Baring Foundation, normally talk about creativity, sometimes interchangeably with arts, but for the sake of these few comments I'm going to make, I'd just like to emphasize that we're interested in the broadest possible range of creative expression, and that would include so-called popular culture or popular art. Again, all these terms are open to question. I'm just going to say a couple of words about the organisation that I work for those of you that don't know us, perhaps many. The Baring Foundation's an independent funder. We've been going for over 50 years, and in all that time, we've funded creativity and the arts, but that's one part of a broader program. Central to everything that we do is a wish to challenge and tackle discrimination and disadvantage, and to view that from a concept of human rights, including when it comes to creativity and culture, and seeing access to culture and the capacity to be creative themselves as rights. And that shapes how we look at the arts and mental health. I won't talk about our other programs, but there are two other areas that we're working in. And sadly for us, and possibly for some of you, we are a small foundation. So we will be funding around £1.25 million of work in arts and mental health for probably the next 10 years. We haven't got an end date as yet, but we hope very much that that will increase as we form partnerships with other funders. So over and beyond those couple of introductory comments, I'd like to think for a moment about history. I think history is important. There have always been artists for whom an experience of mental health problems has been important, or sometimes quite central to their work. And although the concepts that we're using now would not have been the concepts hundreds of years ago, we can see the traces of those discussions in their work. And we can all instantly think of, for instance, visual artists. Some of the biggest exhibitions in the last couple of years have been by Munch and Van Gogh, with quite direct discussions of their mental health experiences. Yuya Kusuma is probably one of the most visited, seen artists in the world, who for a long time has lived nearby a psychiatric institution in Japan, and has found that the basis of her support and her practice. But there are vast numbers of other artists that we could talk about. Perhaps something that's discussed less is that alongside artists themselves, there is also a long history of creativity in mental health settings. And certainly roughly 200, just beyond 200, less than 200 years ago, in the early Victorian times, there's important records of creative work, mainly music, singing, and visual arts in what we would now think of as mental health and psychiatric settings, and a very clear understanding, though this was by no means universal in those hospitals, that was an important part of the experience of the patients living there. But I think it goes beyond that, that when we look in more recent times, this field of arts and mental health has been very much shaped and part of a broader story of changes in mental health services. So that big deinstitutionalization, so-called care in the community in the 1970s, 80s, for instance, very much influenced the increase in activity in the arts in the community. Organizations were formed. I'm thinking of, for instance, Art Angel in Dundee, directly by people who were service users in psychiatric hospitals, who then left those hospitals to live in the community and brought with them work that was taking place on hospital wards and created their own organisations in the community. There's also, I think, an important interleaving between, as it were, the protest history of mental health and questioning of diagnoses, of discussions of people being survivors of the mental health system, of the radical questioning of psychiatry in the 1960s, both by patients and also by some psychiatrists themselves. That political history is also very much a part of artistic history, with artists adding their voice to that debate. I think it's a fascinating area. There was a really interesting exhibition, for instance, I think 2 years ago at the Bethlehem Museum of the Mind, of that history of protest by patients, and patients that were then going into the community. And the exhibition, if you want to look it up online, was called Impatient. I think there's a lot more to be said about the history of developments of creativity and mental health. I'm delighted that the Mental Health Foundation in Scotland is actually producing a report very, very soon, looking at the experience since the 1960s up until 2000 about that history. And there'll be a rich digital archive of artists and founders of art organisations about their experience of mental health. The last thing I'd like to say, thinking about history, is that I have been struck, though it's probably unsurprising, that in, I would say, well over 100 conversations, perhaps almost 200 conversations, I've had with people working in arts organisations concerned with the creativity of people with experience of mental health problems, how often those organisations have been founded by people with lived experience. That's been their motivation for the creation of the organisation. Or at the very least, as it were, and this is also an important experience, it's been an experience of mental health problems in family members that have driven people to a realization of the importance of creativity. So I want to say a few words about the report that I think there's a link to, Creatively Minded, that we published last February. As a very untidy person, thankfully you can't see much of what's around me. I'm probably cursed with a rather tidy mind. And part of that report is trying to look at definitions and categories. And it's a fool's errand. Everything is elusive and things are very hard to categorize. But perhaps it comes with the territory of being a funder that we need to have some definitions and to know what we're talking about. That report, Creatively Minded, has got a really, really important omission, which has been commented on frequently, which it does not talk about arts therapy. I hope there's no inference that that's any lack of respect or value for arts therapy, but it is to say that it can be viewed differently from participatory arts, which is the centre of our report. Our report also doesn't talk about so-called voluntary or amateur arts, which are also very important. Rather, we're saying that there is this actually very broad field of artistic, creative, professional, and I'll come back to that word, activity with people living with mental health problems. And as an organisation that was just starting to look at the field, we felt that was more than big enough for our consideration and our funding. So almost everything in that report is about arts organisations that are working in the field. But what sort of arts organisations are we talking about? I think that there's a surprising number of arts organisations that see this as their sole focus. Certainly when we're beginning to think about this issue, I wasn't aware of that, and many people that I talked about weren't either. And we gave last September, and we're delighted that that included hospital rooms, 87 grants to organisations that focused either very, very strongly or in the majority of cases exclusively on working with people with lived experience of mental health problems. That was their raison d'etre. Almost the vast majority of those organisations are small. There's one or two with a budget over $1 million, but it's not even the fingers of one hand. About half of the organisations have a budget under 100,000, and a quarter had budgets under 30,000. So I think you might agree with me that these specialist organisations are certainly small, and with that often there is both a fragility and a resilience that comes with that. Certainly the vast majority of them would see their work as very local and necessarily small scale, because their resources only allow them to deal with, to work with, engage a relatively small number of people. So that's people that are very specialist, organisations that are very specialist. We then have, I think, a largely different tradition of that would describe itself as disability arts. That's got its own history and trajectory, particularly arriving at the same time in the 60s and 70s, and discussion about disability. By and large, those organisations are concerned with people with physical disabilities and people with learning disabilities. As I think everyone will know, a mental health problem is classified legally as a disability under the Equalities Act, but there hasn't been much overlap. There are exceptions between those disability organisations and work on mental health. There's then a much bigger field of arts organisations that are specialising in areas where I think everyone would agree there is increased risk of mental health problems. However, that isn't the framing of the organisation. So an obvious example, some of those areas would be arts organisations working with refugees and asylum seekers, with homeless people, in prisons, care experienced young people, all of which, for I think fairly obvious reasons, have an interrelationship with increased risk of mental health problems. And I think there's a difficult debate or complex debate there about the degree to which those organisations are seeing themselves as specialising and thinking about mental health. Cardboard Systems, for instance, a very well-known organisation in the theatre field, would very definitely say that that was a major concern. We then have an even broader field of participatory arts, difficult definition, but we would use that as community-based arts, where people with either a great deal of experience, who would say, I am an artist, that's my living, that's what I do, or that I have a particular form of professional training, that those participatory or community arts organizations are working with, have specific projects with people with mental health problems. And again, a large number of those. What I think is interesting, lastly, when thinking about arts organizations in this area is, and I've never found that there's a grant going to anyone that's got a better name for me than this. I keep saying mainstream organizations, and I don't like it. But what I mean is organizations that would see themselves as, I mean, very big examples would be big cultural institutions like the South Bank Centre. I'm trying to think of Norfolk. You've got your writing centre, the museum. By and large, those have not specialised. There are variations, but I particularly think it's marked that for the last 10 years, the Baring Foundation's been funding work on older people and creativity. And in that field, there has been a tremendous swing where, starting off with a small number of very specialist organisations working in care homes, working with people with dementia, now there are very few arts organisations of any scale, certainly the large ones, that would not say that they're interested in people living with dementia, in their offer to older audiences, on outreach to lonely, isolated older people. That doesn't, by and large, seem to have happened yet with mental health. Perhaps there are good reasons. In the last 2-3 minutes, that's the arts. We've then got this hugely complex mental health system. And on page 23 of our report, you will see what I think is a fairly numbingly complex attempt at a description of that mental health system, described by its author, who is a psychiatrist, as extremely oversimplified. So I'm just saying that, particularly when we're thinking about partnerships, which I know we're just about to go on to, there is often a difficult but very important dialogue between those hugely different sorts of organisations. Also, as a national funder, I need to think that there are 4 very distinct NHS systems in the UK. And for instance, we're working quite closely with the Arts Council Wales, where there's a better integration in lots of different ways. The last thing, thinking about the NHS, would be wrong not to mention this, is that we've got this enormous development of social prescribing, particularly in England, which has got huge implications for everything that we're thinking about. So that's, there is much more in the report. I hope that's given you a flavour. We published that in February last year. A few of you may have noticed that a lot happened after February last year. I think that, of course, the impact of the pandemic and lockdown is profoundly important for people who are already living with mental health problems, and to the increase in that rate of mental health problems, the ONS, so I'm sure you all know, claiming last year in June a doubling of rates of depression. There's lots more on our website if you'd like to pursue this conversation. Since that publication, we've given a lot of grants. We've been funding a few festivals, a new one in Wales, about to fund a festival in Scotland. We've got a new to us, very, very important grant round, looking specifically at ethnically diverse communities. We've got what I think, as I didn't write a single word of it, I think a great report on that with a lot of commentators and people with lived experience and case studies, which is called Creatively Minded and Ethnically Diverse. And you'll see a few more reports. So to conclude, when we first started to think about a new funding field about creativity and people with lived experience and mental health problems, I was told, well, you're a small funder, it's probably a good area for you. Little money will go a long way. There's not much happening in the field. And I look back, and the person that said it to me is a knowledgeable, thoughtful person. Why on earth did they think that, given everything that I've just said? And I think in some ways it's not surprising, because a lot of the activity is very small scale. It's beneath the radar. People haven't got the resources to go into the media to talk about what they're doing. And I think it's not valued sufficiently. That's not the only reason, but it's one of the reasons. So I really want to thank you very much indeed for inviting me to this seminar, because I think it's an important part of that process of giving greater value to this incredibly important work. I remember in what I call the before times, before February last year, I used to go and visit places outside my front door. So I hope in the future you'll be kind enough to let me come and see you and come and see the work in Northside House. Thank you very much.
Thank you, David. Very much like you to come to Norwich and see what's happening up here when that's possible. And thank you very much for our first keynote presentation. Lots of relevant themes and points for discussion there, which we'll come on to hopefully in the panel discussion. I'm the next speaker, so rather than introduce myself, I'll go straight into my talk. Share my screen. Okay, thank you. So my talk is coming to being partnerships and collaborations, and the themes of the talk are around creativity and the relationship of creativity to recovery in mental health situations. Second theme is quality of environment. And then thirdly, I want to talk briefly about collaborations and partnerships within this context. In 1978, Susan Sontag wrote in her essay, Illness as Metaphor, that, quote, everyone who is born holds dual citizenship in the kingdom of the well and in the kingdom of the sick. Although we all prefer to use only the good passport, sooner or later each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. Sontag's subject is the unreal and often punitive uses of illness as a metaphor in Western culture. Her point is that illness is not a metaphor, but a lived experience. And that the most truthful way of regarding illness, she actually refers to it as the healthiest way of being ill, is to resist such metaphoric thinking. The other quotation I want to use to frame my presentation is from John Cage. And it's Cage's aphorism, I have nothing to say and I'm saying it. Cage's aphorism identifies how a frame of communication, be that frame a book, an art gallery, a research symposium, a mental health unit, conditions what can be said and how that will be communicated. It conditions behaviours. I'm using it to refer how the environment of a mental health unit elicits forms of response and forms of behaviour. Not only have we all been affected by mental illness in various degrees and in different ways, but we all attempt to make sense of our inner individual experience and our inner monologue, dialogue, multilogue, in terms of a reality that we are presented by our families and by the dominant realities of a society and its media. Attempting to make sense of the world, is clearly hardwired into as a human trait. And for me, it is a wellspring of all art and creative activity. Also, creating something, we are coming into being, to use a phrase borrowed from Kurt Vonnegut. For Vonnegut, creating something is its own reward, in that it is an experience of becoming. He says, practice any art, music, singing, dancing, acting, drawing, painting, sculpting, poetry, fiction, essays, reportage, no matter how well or badly. Sing in the shower, dance to the radio, tell stories, write a poem to a friend, even a lousy poem. Do it as well as you possibly can. You will get an enormous reward. You will have created something. The focus of the Northside House project and all the projects that Hospital Rooms have been involved in is to improve the quality of the environment of the mental health units that people work, live and are treated in through partnership, co-production and research. Quality of environment in this context doesn't only refer to the works the artists produce for the projects, although this is a very important aspect clearly. It is also about understanding the value of interaction through creative activity and endeavour in an environment that can support and encourage such interaction, an environment that can foster a sense of coming into being. I'm not a mental health professional. It's certainly not my area of expertise, but I speak from the experience of someone who spent his professional life working in and helping to create environments within art schools and art faculties that support creative activity and endeavour. Mental illness is mostly seen by or projected by society as an individual tragedy and maybe a family tragedy, which of course it is. But by implication, it's also projected as an individual failing, perhaps even a family failing, rather than a failing of the society, a failing of the duty of care which a society should have for its citizens, in the UK, for its subjects. A failing of the quality of the environment in the broadest sense, within which individuals can thrive, make mistakes, recover from illness or addiction, trauma and crises in their lives. It's been said before that although we have what is called a National Health Service in the UK, it is actually mostly a National Illness Service, and no less valuable for that, clearly. My point is that in facing the future of mental health and well-being, we should focus much more on becoming a National Health Service, so there will be less need for a National Illness Service. One of the ways we can do that is to target the mental health and well-being of children and young people, which I know is a focus of many support services in city and county councils and in the health service itself. In doing this, we might bring together mental health professionals, nurses, psychologists, psychiatrists, therapists, with service users and managers of mental health services, and with artists, architects, set designers, musicians, writers, and craftspeople, so that we can learn from each other and explore how the quality of the environment and support can be improved. In our modest way, this is what our partnership at the Northside House projects are attempting to do. A past model for this is the Finsbury Health Centre, designed by the Tecton architectural practice, with Berthold Lebeckgen being the main architect in a deprived area of London, Finsbury, in 1938. Finsbury Health Centre was part of a project to improve the conditions and well-being of the people living in the borough. It was also to include baths, libraries and nurseries, which didn't happen before the Second World War broke out, but the Finsbury Health Centre was built and opened in 1938. It was a project led by Alderman Harold Riley, leader of the council, and Councillor Chuni Lal Kashol, a recent immigrant from the Punjab, from India, There was a GP practicing in Finsbury, and at the time was chair of the Finsbury Public Health Committee from 1935 onwards. Cashel approached the modernist architectural firm of Tecton to design the Finsbury Health Centre. And in 1938, Cashel was elected the mayor of Finsbury, became the UK's first South Asian mayor. The centre was groundbreaking in both its services and the quality of its environment, including doctors' surgeries, antenatal and mother and baby units, TB clinic, a chiropody clinic, a dental surgery, and a solarium, as well as a campaign of raising awareness about healthy living. These are the images of design thinking that Tecton used, of the relationship between, on the top left, the old doctor's surgery, dark, dirty, a prison atmosphere, lack of confidence in everything, and then the environment they wanted to create. The environment included an open and light-filled reception with ceilings painted sky blue with red painted columns. This is a later photograph, but with the same colour scheme, the original colour scheme, and with murals to promote the importance of light, fresh air and exercise to health. Remember, this is 1938. And on Gordon Cullen's mural there on the left, you can see it says chest diseases are preventable and curable, which may be relevant to what's happened to all of us in the last year. Also, the children's solarium included stools designed by the Finnish architect and designer Alvar Aalto. The architect Lubetkin said that he designed the shape of the centre not only to capture as much light as possible, but the curving facade and outstretched arms welcome people and were intended to introduce a smile into what is in fact a machine, to quote him. Maybe this combination of health professionals, counsellors, health managers, artists, architects, designers, service users working together to improve an environment could be a model for a way forward. In 1943, a year after the Beveridge Report, the Finsbury Health Centre was used on a poster designed by Abram Games and issued by the Army Bureau of Current Affairs in its wartime home front campaign, What We Are Fighting For. Here, Your Britain, Fight for It Now. Here, the image of the Finsbury Health Centre is used by Games as a symbol of a better future. Actually, soon after it was released, the poster was withdrawn as being too radical, and apparently Churchill himself thought the image of the child with rickets in a slum setting was inappropriate. I think the broad message of Your Britain, Fight for It Now and an image of a new kind of health service is appropriate as we emerge from a year of extraordinary stress and trauma and decide how we can build a better future to improve mental health and well-being. Thank you. Can I now introduce Jed Patterson and Sue Pashley? Jed is lead nurse and Sue is people participation lead for secure and forensic services at Norfolk and Suffolk NHS Trust. Thank you, Sue and Jed.
Hi everyone, I think Jed is currently muted, so there he is.
Yeah, somebody had to do it, folks. Somebody. So here we go. Let's try again. Right. I'm Jed, and this is my colleague Sue, who will be talking to you shortly. First of all, this is an amazing opportunity for us, and we're absolutely delighted to have been invited to give a brief presentation on Northside House, who we are and what all this is about and what does it mean to us. What I wanted to, I'm a nurse. I've worked in the criminal justice system and for the NHS for almost 40 years. That's an odd concept to me, and I'm in complete denial. But however, within that time, I've seen some amazing things, particularly in the prison system, but also in psychiatry. So this is an incredibly important moment for us. So today I thought it would be useful to put some context into what our art project at Northside House is about, and hopefully describe the importance of this unique opportunity, certainly for our service users, and Sue will talk about that shortly, but also for families and for carers, for the communities, and in particular our partners who can help us realise some of our aspirations and our dreams. I guess we should start with who are we? So Northside House is a hospital in Norwich, formerly known as the Norwich Clinic. It's a secure psychiatric hospital, which means that not only are people trying to improve their mental health and travel quite a difficult, challenging journey of recovery, but also find themselves in a sort of paradox, if you like, in this particular arena. Not only do our service users have to navigate the clinical elements of their recovery, but also the political, social and legal challenges. And it is indeed a complex landscape which will test anyone's resilience and also hopes for recovery. What are some of the immediate challenges for people in this environment? Well, it's an institution. I'm sure that everyone knows, has a pretty good idea or insight into institutional life. In the institution, custom and practice is king. Routines rule, and regulation brings about blanket rules, which can very quickly establish a static situation, a vacuum. It can lead to a vortex if we stand still. We have to constantly challenge some of the vagaries and the pathology of institutional life. If we don't do that, then we very, very quickly find ourselves in a very sort of backward and negative place. If you could imagine suddenly one day finding yourself in this environment, it's probably the closest thing to a sort of living nightmare that you could possibly imagine. There's been some in David Cutler's keynote presentation was gave us a fascinating brief history of the political landscape, and I thank him for that. It was really, really interesting. But also Simon talked about the environment, which has a significant impact on people's well-being and recovery. And that's everyone. It's the service users, it's the people that coexist with the service users, the staff, and certainly the families who come along in the hope that their loved ones are going through a caring and genuine and sincere process. So the environment is incredible. So what I'm trying to describe here is a closed world, very difficult for some people to imagine having all those restrictions imposed on you, and you have to live to the routine and ask permission to do an awful lot of things. I went to an exhibition at the Wellcome Museum down in London a couple of years ago. It was an incredible museum. Some of the things that Simon touched on was very much a part of that museum. But at the end of it, there was a designer asylum, and it was the vision that service users had for a safe place to recover. And I guess, and I was really quite inspired by that. And I always have been inspired with what comes out of this incredible situation that people find themselves in. And that's the beauty for me of art and dance and music. And these are the things that help connect this internal world, this inward looking world, to the outside world, and to the possibilities of recovery and self-expression, and hope. I met Hospital Rooms a couple of years ago down in Sussex, and I was absolutely blown away with the energy, with the artists, with the real hope that they had for people. And we were very, very lucky to maintain that contact over the last few years. And so just over a year ago, Tim and Neve talked about the possibilities of linking up with the university. We've had a beautiful collaboration in a very short period of time, a very sort of powerful relationship, and everything is about relationships. And what these organisations and the artists bring to this closed world of Northside House is the hope and the inspiration and fresh relationships for a life in recovery, and an opportunity to really express their hopes and hopefully that link with the outside world. I've already gone over my little time allocations for this. It's
all right, nothing new, Jed. Nothing new.
I'm looking forward to the rest of the day, and hopefully chatting to some of you guys later. I'm going to hand you over to my wonderful colleague now, Sue Pashley.
Hi everyone. So as People Participation Lead for NSFT Secure Services, I sit on the leadership team, and I'm in a privileged position to be able to bring to the role 5 years lived experience of inpatient services, including secure care. So the main focus of my role is quality improvement, and specifically patient experience and outcomes. Living with, managing, and for periods of time battling with a relentless grip and torment of mental illness is hard enough. But then add to that the challenge of lengthy detainment, and every minute and every day becomes hopeless and often unbearable. Those 5 years detained were the darkest of my life. Days were filled with fear, confusion, paranoia, emptiness, shame and uncertainty. A world where I was confined in space, where time stands still, and where the focus of your thoughts and emotions are intensified. An environment driven by routine, but where there is little to fill the 24 hours a day, 7 days a week, and where the physical space is often stark, cold and clinical, where walls are whitewashed, tired and uninspiring, just a trapped space where there's no escape from it, no respite from it. It is the relationship and the interactions and the opportunities within the environment that help us support recovery. And I've often questioned and reflected on what helped me move forwards from the incredibly dark place, rocking in the corner of a seclusion floor, where the aspiration I had was for nothing more than to be removed from the service in a wooden box. And how did I get to a place to be more hopeful about recovery and discharge being a possibility? For me and for many, it can be found in the connection with people, with the arts, and opportunities for creativity. Once a week, a space to mindfully explore creatively, whether throwing a pot, painting, drawing, weaving, sculpting, flower arranging, creative writing, poetry, or photography. It was a place to channel my emotions, to express my intrusive thoughts in a way that felt safe to me. It was a medium for expression and for escape. My involvement in the Kess Awards were particularly important milestones in my recovery. The art room became my solace. It was a place where I felt more hopeful and understood, where I felt free of judgment. Now I find myself on the cusp of a unique opportunity to work collaboratively with colleagues and with artists, and most importantly with service users, to transform a space within a service, to provide inspiration, colour and opportunity. I know personally that this project and this journey we will work together to create an arts and a social space, which will be life-changing, life-enhancing, What feels so important to me is the knowledge that we're creating a space that will become the heartbeat of our service, pumping out hope, light, colour, inspiration, and a philosophy focused on recovery, expression, new beginnings, freeing people from the shackles of detainment, diagnosis, risk, and hopelessness. It will help us as a service to provide a space and an opportunity to connect better with the patients, with their loved ones and their family, and probably more importantly, our community. Breaking the stigma of a secure service as a stark place where we detain the criminally insane, but instead a space where the talents can flourish and where we can connect healthily with the outside world. I cannot underestimate to those people on the call the potential impact of this piece of work on the service users' lives, on the staff's environment, and the hope for new beginnings and for change. And I'm incredibly proud to have come on the journey myself, to be in a position to be able to share this opportunity with our patients and to finally give them some hope that from a dark place they can find new beginnings and be inspired by the artists that have given up their time and space to do something really special with our service. And Jed and I feel incredibly proud to be involved in this project, and we know the potential for it to be life-changing. Thank you.
Thank you, Jed and Sue. Thanks very much. It's really such a valuable kind of perspective on our discussion today from the two of you. The next presentation is by the co-founders of Hospital Rooms, Niamh White and Tim Shaw, who will talk about the focus and I hope about the hugely impressive achievement of their organisation over the past 4 to 5 years. Thank you, Tim and Niamh.
It's quite difficult to follow Sue. What an incredible testimony, and an absolute pleasure to be working with her and Jed. But I'll do my best. So thank you so much for joining us today. My name's Niamh and this is Tim, and we co-founded Hospital Rooms. Tim's an artist, I'm a curator, and we worked with artists, galleries and museums for the first 10 years or so of our careers. In 2016, everything changed for us because a close friend of ours had a suicide attempt, and she was sectioned under the Mental Health Act. And she was required to stay in a mental health unit that looked a little bit like these. We were really shocked to find out that this space, when she was so vulnerable and at such a low moment, was where she was supposed to recover. And we thought that that wasn't really going to make much sense. We had a little look into it and we found out that this wasn't an isolated case. Mental health units are recognised as being inadequate by the CQC, which is the health regulator. It's noted in the NHS 5-year forward view, and it's noted in the new white paper that's just come out from Parliament. And so we hatched a plan. We felt that our community, the arts community, could really come and help with this, and that they could work with service users, with staff, and really radically rethink what these spaces could be and how they communicate to people. So this is a case in point. It's a recovery college at SWLSTG in Tooting, and it's a pioneering service. It's the first of its kind. It runs courses for people who may have been discharged from mental health services and leads sessions on things like learning to live with hearing voices, to support for people who have experienced domestic violence. But walking up to this building, I don't think that you would think I am a valued member of this community about to receive award-winning care. But we suggested, you know, what if you did? And what if when you were taken to a de-escalation room, when you were particularly disturbed or particularly unwell, it didn't feel like a punishment, but it felt like a sanctuary. So this is what we think is really important, and what we do across a range of different services, from older people's units to rehabilitation to psychiatric intensive care and mother and baby units. And we think about how we can communicate confidence empathy, and empower people when words fail. We actually didn't realise how effective our work was going to be in forensic settings. Our process is as such that our artists work with the community in the service, they lead creative sessions, they ask for input, and they co-produce really fantastic artworks with that community. And through that process, we've seen people open up, we've seen people gain confidence, and we've seen people contribute in the most fantastic, innovative, and extraordinary ways. And we've seen how that can lead on to education and employment opportunities. And there's a particular project that we found really effective over in the Hellingley Centre, which Tim is going to tell you a little bit about.
So we've been going for about 4.5 years, and over that period we've completed 14 projects in inpatient units, and that's about 100 art installations. In 2019, we embarked on a project with the Hellingley Centre, which is a medium secure unit in Sussex. And it was a particularly amazing project for us, and not least so because we got to know certain people, the staff and the residents, really well. And we were used to working a lot in psychiatric intensive care, where the average stay might be 6 to 8 weeks, or mother and baby units where the stay might be 6 months. But through this project, we got to know everyone really well from start to finish. And I just want to show a 20-second excerpt of an animation made with by Sophie Clements and residents from the Hellingley Centre and other people at the Trust. And just to bear in mind that every sound you hear in this is a sound recorded by the guys at Hellingley Centre, and it's been made to music.
In Spain last year. I was out of hospital, believe it or not, which is a wonderful thing in itself.
So you can watch that whole 10-minute film on our YouTube. I think it's a bit of a masterpiece. And there was so many creative people there, and we worked with 6 artists, and between everyone, 6 artworks were made for the Hellingley Centre. One of them brought the outside into the atrium. Lothar Gertz made one of his geometric artworks for the TV room, which was especially cool because he, at the time, had just opened the huge facade artwork for the Towner Gallery just down the road. I worked with about 20 residents there to create this artwork based on the Bayer Tapestry. Sophie made our first ever permanent video piece in a corridor that used to be called the Green Mile, but now has 8 permanent videos of water gently moving at the end of this corridor. And we had our first ever artwork bird boxes, which is very special for us. And these were installed around the outside areas of the unit. And Richard, we're very lucky, is going to be working on the project at Northside with us, made this wonderful piece called Paginations that runs through Ashward and fills the space with words, words, words. So after that, we worked with another medium secure unit, and this time for adolescents, which we had 6 artists again, and we had some amazing works for all the communal spaces. And something that we found is that we're quite used to working in places that are pretty dire, but we've also worked with some new builds and some units like Northside that are well designed and well kept. But the thing the art does is it brings a bit of humanness to it. And even the architects from this unit that we work with were really keen that that we brought some kind of life and humanness to these spaces. And I think the artwork really did that. We're really happy that we're working again with NSFT. We worked with them before at Woodlands with Maggie and Tara and this amazing team there, and Carl as well, who'll be working with us at Northside. And we're especially excited that we're working with Jed and Sue and the team and all the residents and Simon and everyone from NUA. I mean, I think it's safe to say that we're in love with Jed and Sue and everyone at Northside. And it's people like them that go above and beyond, and they make the impossible possible. We've very much been told that you can't do projects like this in secure settings, and they make it not just possible, but they make it a joy for everyone who takes part. At the end of this project, we'll be doing a public exhibition in a gallery in Norwich, and we'll be showing work by the professional artists, telling the story of everything that we've been working on together. And also there'll be lots of works by the residents at Northside House. We hope we'll all be there in person, and we hope maybe there's some optional hugs as well. So thank you very much.
Thanks, Niamh and Tim. Great stuff. Our final presentation for this part of the symposium is by Dr. Nicholas Simpson, who's a research fellow at Norwich University of the Arts and a research associate of the Northside House project, and Phoebe Eustace, who's the project curator of the Northside House project. Thank you, Phoebe and Nicola.
Thanks. I'm just going to share my screen, so let me know if this works. Yes, great. So thanks, Simon, and thanks everyone for all the fantastic presentations so far. Also, just to echo Tim, we are in love with everyone at Northside, Jed, Sue, everyone on the project, and it's a real pleasure to be working with you all. So I'm just going to give a quick overview of the needs and the challenges of evaluating Hostrooms projects, and then Nicola will go into more of the specifics of the framework that we're currently developing at Northside House. So as you've seen and heard from Tim and Niamh, our projects and artists radically transform spaces. And really at the centre of what we do is building this close working relationship with patients and staff who have daily experiences of these environments and therefore can give the most valuable insight and critical feedback. It's really crucial to capture this, not only through understanding the impacts our projects have on the environment, but also through the individual subjectivities of patients and staff. So evaluating in this sense allows us to create a continuous feedback loop in order to improve our processes and curate our projects with acute awareness. So Niamh briefly touched on this, but just to go in a bit deeper, our workshops are a vital part of the project. They're an opportunity for the artists to work with the ward community and to get a sense of the environment. And as you can see from the images, they vary greatly from life drawing with owls, printing with squid ink, wax rubbings, t-shirt painting, and often the finished work that comes out that the artist makes for the ward is directly or indirectly informed by these workshops. For me as a Hostrooms team member, working with patients and staff on these projects is incredibly rewarding because of how clearly we can see relationships building between the artists and the patients and staff through creativity, creative processes, and the nuances that come out of this experience. But these things can also make evaluating and capturing and recording these moments as data much more complex. So we facilitate workshops in a variety of different mental health settings, from psychiatric intensive care units to mother and baby units, and therefore the needs and requirements of those participating differ from project to project. Is something quite different from community engagement in a gallery, for example. And in the past, we found that using standard arts evaluation tools can be quite inaccessible with questions that aren't very applicable to patients doing the session. A multiple page form can also inadvertently dampen the excitement that's been generated through a session. So in evaluating our workshops, we require tools that are inclusive and accessible and that don't detract from the experience people get from participating in the workshops. So what we're aiming to do through our collaboration with NUA and with Northside is to develop a robust methodology that's workable across all of our projects in order to create a gold standard for evaluating creative projects in mental health units. In previous projects, we focused on qualitative methods, so things like reflective diary entries, first-hand observation, semi-structured interviews and questionnaires. And we're now at a point where these are becoming an essential component of our project process. So these methods, especially interviews, allow for in-depth exploration, and we found them to be really significant in the hospital room's narrative. For example, something that came out of an interview with a psychiatrist of a project in 2019 was the correlation between the perception of time and effort spent on an artwork made for the unit by a world-class artist and an increase in patients' sense of self-worth. But alongside these qualitative methods that are more directed towards individual perception and that often happen at the end of projects, it's really important to create comparative data that allow for a wider scope within hospital rooms and then that can be transferred to other arts projects in similar settings. So something that we're developing at Northside and that Nicola will touch upon is the idea of mapping spaces before and after the artworks are created for the wards to observe whether there are changes in movement, behaviour, congregation, as a way of sort of having more quantitative data to back up our qualitative research methods as well. This is the last bit for me, but going back quickly to what I mentioned earlier about the need for inclusivity, we've recently started using this form that you can see on the screen now at the end of workshops at Northside, and it's proved to be really successful in creating a balance between self-expression and accessibility. So it was developed from the traditional arts obs scale, but instead of using it as an observational tool that is recorded by us, patients are able to identify how they felt before and after the workshop and write any other comments that they might have. And I think the sort of playful element and the way people can relate to the different expressions of emotion make it much more inclusive than other tools that we've tried in the past. So in terms of the needs and challenges, one last thing I want to mention is having the time and resources to evaluate effectively. And something that I found in recent workshops that I've facilitated at Northside is that having dedicated team members and ward staff who are responsible for doing things like the reflective diary entries or ensuring that patients have the opportunity to express feedback is really paramount to the process. So this seems like a good opportunity to pause and hand over to Nicola, who is collaborating with us and supporting us greatly on developing this methodology. So Nicola, over to you.
Thank you very much, Phoebe. A lot of what I'm going to say is actually just going to echo what Phoebe's just said, but I thought before I go on to talk very briefly about the evaluative design Norwich University of the Arts has been working with hospital rooms and Northside House, I wanted to just mention some of the wider contextual challenges to evaluation that this project has been facing and many other projects in the sector too. In a recent conversation, 36 leading UK-based art practitioners and evaluators and researchers, including speakers from ACE, Arts Council England, and the Culture, Health and Wellbeing Alliance, met to discuss the challenges of evaluating creative practice for health and wellbeing in the pandemic. It was noted that the current COVID-19 global pandemic had accelerated the need for collaborative and co-produced approaches to evaluation, and that there had been a noted shift from quantitative outcomes evaluation to qualitative impact and process evaluation. 4 key challenges were outlined: a lack of time and resources, concerns around rigour, ethical worries around including but not burdening participants. And all of these 3 concerns have been greatly exacerbated by the strain COVID-19 has placed on healthcare environments and staff wellbeing and morale. So Norwich University, with these challenges in mind, has been collaborating with hospital rooms on the Northside House project in the development of a model for sustainable evaluative practice that translates effectively, initially from one hospital rooms project to the next, and then further afield across other arts, health and wellbeing sectors and projects. In effect, we're trying to support hospital rooms in addressing these challenges, but particularly the lack of time and resources in the process of evaluation for projects like this. So thank you, Phoebe. Can we go back to the previous slide? Sorry, perfect, thank you. So in considering some of the personal outcomes for the service users and thinking about some of further evaluative questions, we've come up with these aims. Can we improve the measurement and documentation of the subjective impacts of participation in an arts project by patients at Northside House? Does participation in the arts project lead to a change in wellbeing scores among participants? Can we improve measurement and documentation of the subjective impacts to patients from changes to the environment through the artwork installation? And do changes to the environment through the artwork installation lead to changes in wellbeing scored among participants? Next slide, thank you, Phoebe. Because of this, one of the challenges outlined in earlier, the ethical worries about including but not burdening participants, previous projects and evaluative data collected by hospital rooms has led to, there's an enormous of rich data actually to do with the effects on the environment and the effects on staff too. So what we've tried to do with this project is embed those kind of outcomes into our evaluative questions, and very much focusing not just on the outcomes for service users, but actually the outcomes for staff and the environment. So we've come up with some of these questions. What effects of the project on communication between people within the workshop settings can be documented? Can we measure and document any effects from the artwork installations and what these have on the communication between people on the wards? And this is a particular interest of ours. What are the subjective impacts of participation in an arts project on staff at Northside House? And again, this is really interesting because a lot of the data from the workshop show that, you know, there is as many staff participating in workshops as there are service users, and we're trying as much as possible to see how that engagement by staff improves their well-being. Does participation in the arts project lead to a change in wellbeing score, among staff? Can we measure and document any subjective impacts to staff resulting from the arts installation and changes to the environment? And do these changes to the environment lead to a change in wellbeing scores among staff? Can we go to the next slide, Phoebe? Thank you. So as Phoebe mentioned, one of the ideas we have is looking at mapping the spaces pre and post the installations of the artwork. And why we've come up with this idea is there is a lot of data that has come from these semi-structured interviews and testimonials from patients and staff from previous projects about the changes to the environment and how that changes their behaviour. I'm just going to read 4 of these anonymous comments from a recent project Hospital Rooms did with the Ellen Skellen project, a psychiatric intensive care unit in London. I was going to say, there is this serenity about it. They like to sit around that table, sitting in that table and chatting. It feels like sitting around in a park. It's soothing and relaxing. I was really relieved to hear people just sit and contemplate the art in the forest, because I sometimes do that too. I come into this family room when my thoughts are racing. I have on a couple of occasions taken a couple of minutes or even seconds to get that respite from the ward and from my thoughts. It's really nice. And that's a comment from a staff member. Since the artwork is up, we've had less acuity, but we don't know if that is the art. There are so many things that it can be, but it could be part of it. I really like how the different areas have a different character. They're now separate spaces with their own feeling. When you move to different ones, you get a different sense. Before the ward, it just felt like a ward, one big space. So comments like this are really not the exception at all. And as Phoebe has outlined, many of these comments come from the qualitative research methods used by hospital rooms, such as the visual matrix and semi-structured interviews. However, almost all that data is gathered post-installation of the artwork. So what we're going to try and do is to work out with Northside House project is work on the feasibility and practicality of carrying more data gathering before the artworks are installed. We're going to introduce this notion of behavioural mapping and try and look at how the staff and the service users move around the space before the installation of the artworks and afterwards. We're going to try and record physical and social behaviours in various functional, transitional, recreational zones post and pre-installations of the artwork. And Phoebe and I are very excited actually that we're going to be able to start this next Thursday, hopefully at Northside House. And again, it goes back to one of the challenges at the beginning I mentioned. This is only possible from the really goodwill of the staff at Northside House, and particularly Jed and the other members of the staff on Catton Ward. So a great thank you to them for that. Okay, thank you.
Right, thank you, Phoebe and Nick, for that. Really helpful. We're now going to convene the first discussion panel of questions for speakers whose papers you've just heard. But we're also joined by Darren Downey, who's a service improvement advisory member for Northside House and for the Secure and Forensic Services at Norfolk and Suffolk NHS Trust. Welcome, Darren. Thanks for joining us. I'll field some questions that have come in. So we have a question, first of all, from Melanie, which I think may be directed towards David. Is David still with us? Yes, I'm sure he's there. Melanie said she graduated from Newer about 11 years ago after completing a foundation degree in arts and wellbeing at City College Norwich, and then visual studies at Norwich University of the Arts. So Melanie's one of those important people for us as a creative person who stayed in the city and is helping and working in arts and health. She's a director of the arts facilitators of Art at Work, based in Norwich. Small organisation that delivers creative arts workshops, mainly for women with mental health issues. And she said, we see firsthand how creativity really helps improve well-being. But this is the question. Working in this field all the time, I find funding is always a big issue. Apart from it being extremely competitive, funders don't seem to like funding ongoing projects. And how do you think this could be addressed? I don't know if anybody's got any miracle cures for that, or David, if you've got.
Well, I'd certainly like to respond. And first of all, I think Melanie's completely right. It is the question that most is most relevant, is most immediate to a hell of a lot of artists and to arts organisations. I'm not going to have a good answer for you, but I'll have a go. And I don't underestimate the importance of what you're saying, because when you look, and we haven't talked about this, at the stresses and strains on artists and people running arts organisations, they're terrible. They're, some of the research about the levels of depression and anxiety on people in the creative workforce are really, really worrying. And there's a fantastic report from Northern Ireland, and I'm sure that part of that is about funding. So please don't think that I don't recognise it. I do. Please don't think I think we're not part of the problem. I suspect we are. But a couple of points. I think you're particularly right about the need for continuity for service users or participants participant artists, and particularly in this field, that's so important, and funding undermines that. From our point of view, I mean, the thing that keeps me awake, it's immense privilege being a funder. The only thing that keeps me awake is who we're not funding. And who we're not funding is vast. So if we were to just to give entirely justifiable, suitable grants simply for continued service provision and do that on a long-term basis, I guess we'd be funding about 40 artists, something like that. And that would mean that we weren't touching, something enormously over 99% of the rest. So if we do have, and I certainly think Melanie's right, the balance is wrong, and there isn't enough core funding and there isn't enough long-term funding. You're right, but grants are only one part of that, because sustainability, I don't think, is going to be answered by arts funders, particularly of our scale, which is tiny. And I'm sure she's doing this. It is a mixture of different forms of funding, but that's very difficult in this field because often there aren't that sort of trading income that you can go from. So you're right. I apologize that I haven't got a good answer. The thing that we are trying to do is to influence the bigger, more important funders, the arts councils, the much bigger foundations, and the NHS, who won't get it right, but they'll be able to do enormously more and better than we can.
Thank you, David. Does anybody else want to come in with a magic bullet for Melanie on long-term funding?
I mean, yeah, it's a massive question, and it's a huge challenge for hospital rooms. And in some ways, annoyingly, it's a huge part of my job now, is actually just resourcing projects and ensuring that we have enough money to pay our artists and to enable them to create something fantastic. You know, it costs money to make artworks and to, you know, spend time in units, like good periods of time where we can establish those relationships and get people properly involved. We started off having, you know, really weighted towards grants, but we have diversified hugely. So we have trading income, we have contributions from the NHS now, and various other things. But it's like running 5 businesses, because you're running 5 streams of income, and as well as that, running an arts organisation. So I think it's a massive problem. It requires huge entrepreneurialism and huge energy. And I guess the question is how long you can keep that up. I mean, our team is absolutely astounding what they managed to achieve. You know, there's 8 of us, and my gosh, you could imagine there was a lot more. But yeah, I think it's a huge problem. You know, mental health's been underfunded for years. The arts have been underfunded for years. And it's down to us. We're creative people. We just have to get on with it, you know, and we can't accept that you do projects for free, or you do it with the crappiest materials that you can. You know, you have to persuade people. You just have to go in all guns blazing, and that's the only way that we found works. But it's not an answer.
Thank you. I'd like to come to, I mean, it may be that panel members have got comments or points to make about other presenters, other presentations that we had this morning, but I would also like to invite Darren in to respond to, you know, any points he felt that were relevant from the presentations, or to talk about the Northside House project itself, Darren. But I'll give you a moment to think about that while we go on to another question, and I'll come back to you, Darren, if that's okay, if you've got anything to say. We've got a couple of questions actually around the ethical implications of this kind of work. So Michaela said, what are the ethical implications for observing people's behaviour on secure units pre and post installation of the artworks? Will residents know they are being observed, and how will this affect the reliability of the data? And that's quite a big question, but we can answer perhaps Phoebe and Nicola might be able to answer that. And then Yvette has said she's working at the Grampian Hospital Arts Trust, running art sessions with patients. And something she struggles with is asking for consent when wanting to use images and comments and gathering feedback without making it seem like the session has been, not genuine in some way. This feels even more difficult, Yvette says, working remotely in video calls. And are there any advice for that? Those are both quite big issues, but Phoebe or Nicola, I'm not sure if you've got anything to say to that. I might add to it.
I would just say I think the ethical implications are incredibly important, and that is at the top of sort of what we need to be thinking about when we're evaluating. And I think this is a fairly sort of new process, a new thing that we're looking at. In an ideal situation, it would be really getting staff members from the ward involved and doing it through them. So we're not sort of, I mean, the worst case scenario would be us standing there with clipboards watching, that's not what we want to do at all. It would be much more sort of integrated into how the ward works, and it wouldn't necessarily be sort of rigorous observation. It would just be seeing if there's a difference in where people tend to go and sit to take a break, or where they go to sit for enjoyment or things like that. But I think that that's such an important point, and I think it's something that we really need to think about. And, you know, as I said, in a best case scenario, we would be doing this sort of every week to get the most effective data. And that's something that we will try and do. But at the moment, it's kind of, we're just starting the process. So we're sort of trialing it next week, and then hopefully we can, yeah, take on board those points as well. I know, Nicola, you've sort of researched those processes, but couldn't necessarily find anything as appropriate to forensic settings.
Yeah, I think that was one of the things, you know, the data on this kind of project, or trying to do what we're attempting to do within this particular kind of healthcare setting is not there. Phoebe and I really have been looking really more at mapping the space, as it were, than individuals. We're not really recording too much about individual behaviour as such. We're just looking at how the spaces operate, and keeping it very anonymous, even between who is staff and who is a service user within those spaces, and just looking where people move, and do these chairs, do these areas get used, do they not, you know, that kind of thing. It's ideally, as Phoebe said, we were looking at how it could be integrated into the staff's daily work. But to be honest, as I've outlined at the beginning, you know, there's such a strain on environments, healthcare environments at the moment. We were just looking at how we could perhaps support that or introduce these ideas. It's just, we're just trying to work it out, but it is definitely the space we're looking at rather than individuals as such.
Yeah, I would say, I think, you know, what we've said about Northside House is it's, you know, this is an iterative process of learning. It's not, there's going to be a final evaluation method emerging out of one project, but it's one that these kinds of projects need to look at, so that we can develop it as far as possible, and develop it in order to influence policymakers. I think that's the point of evaluation, for data that can influence policymakers and change policy. The other thing I think that's relevant to that question, and it's a very good one, is from both of you, it's about sharing best practice in this kind of environment, and kind of ethical research, sharing best practice across universities, across all arts organisations, so that we can, you know, together develop best practice. A point that David made about how many arts organisations are working in the field. One of the things is how joined up they are to learn from each other, so that we can, to get things together, develop best practice. And to a certain extent, I think in these kinds of things, with many arts projects, they are, you know, they can be quite isolated, and pooling that learning and best practice, I think, is a key way forward. How we do that is something that we need to you know, discuss a lot further. Darren, could I come back to you? I don't, if you've got nothing you want to ask us or say to us, or observation, please don't feel you have to, but if do you have anything that you wanted to?
Yeah, I'll just personally, I'd just like to explain my situation. Basically, I've been detained for like over 30 years of my life in hospitals, prisons, etc. And like I always had like kind of like an uncomfortable kind of like relationship with art, because it's like you always kind of feel it's got to be perfect. And then through like one of the things about my recovery, because I've now been discharged and I'm free, but one of the things that helped me in my recovery was to like I'd done like a project about my life in art, and it was when you're in hospital, it's like it's hard to actually, because all you see is magnolia, and being able to like delve into art and be able to explore yourself. And I am so like amazed by this project, because there's so many great artists involved, and Jed and Sue and everybody involved. It's like, in a way, I wish I was in hospital to like be part of this. You know what I mean? It's such it's a marriage made in heaven.
That's great, thank you. Maybe you can be one of the artists that Hospital Rooms will commission on another project, Darren.
Yeah, okay.
Yeah, definitely.
Thank you for that. it's really good. Another point I wanted to come back to is the one of, well, let's make 2 points. One on collaboration, and you know how much time it takes for partners to learn to work together, and having, you know, what we're trying to do in Northside House is have a series of projects so that we're not losing the collaborative kind of understanding you build over one project. Because it does take time. It takes time for professionals in collaboration in all fields to learn from each other, to come back to one of David's points, to understand the terms that are used, so that you when you're speaking to each other, you're speaking the same language essentially, that also means giving up some of the comfort of your professional identity and skills in collaboration. So that all takes time. Extending that beyond, and you know, I think it's been fantastic working with Northside House and Hospital Rooms over this project. We've got another project starting, you know, this month as a stage 2 of Northside House. But that takes time. Is how do we get that to the lead teams, and then further up the chain to NHS policymakers. You know, that I think is the challenge. So it doesn't go on being all this fantastic work is happening in projects. These projects need to move in to changing NHS policy and acknowledging how the projects can change behaviours and change policies. I don't know if anybody's got anything to respond to that. How do we get it further up the food chain?
It's not a kind of a direct answer, but sort of around that. I mean, Darren, you said something really interesting, which was, you know, always feeling like it has to be perfect. And I think that's something that we had, that was the problem with our first project, getting it off the ground, is that it took us 1.5 years before anyone would let us in. You know, lots of, we went to different trusts and they said, where's the research to say that what you're going to do, that your project is going to only have a positive effect on the service users at our trust? And that's something that was really, you know, we've kind of learned how unhelpful that way of thinking is. And the other thing you said, Darren, was the word explore. And I think that's something that you kind of need time and space and money to do. And you also artists need time to try things out, and they also need room to make mistakes. And I think it's something that we're often not allowed. And there's a lot of kind of in the world, but also in the NHS and you know, people who make quite big decisions. There's this kind of inherited wisdom, or this kind of Chinese whispers of what's good for service users, and that can often be as simple as saying, you know, things that we've talked about, where, you know, we've been told trees are better than an abstract painting, and you know, white is calming for a seclusion room, and so all seclusion rooms should be white. Whereas actually we've found, just from spending the last 4.5 years, spending most of our time in dozens of mental health units, actually talking to people and making art together, and not asking a simplest question as what would look good on this wall or what color is best, because we all have our own relationships with art and the visual and color, but kind of trying to work out how we could try things out and how we could take some risks together, you know, not doing anything harmful, but you know, what's the point in doing anything if you're not going to try things out and make some mistakes and get a bit better every time? And I kind of feel like maybe that's what we need to be kind of pushing, is that we need time and money and space to be able to make mistakes, and it shouldn't just be these scrappy little organizations like us who kind of find a way to do that. You know, we need you know, I think that to me is the sort of important thing.
But I also think that there is like something to that scrappiness, And sometimes it's a little bit about infiltrating the system because, you know, NHS policy and NHS leadership and structures and it's so massive that, you know, trying to go in with making a policy change just seems so mammoth that you wonder how could anyone ever do it. But actually, you know, that one person who let us into Phoenix Unit that first time, we snuck in and we did this project, and then we persuaded Jed to take a chance and to take a risk, and then we found stars like Sue and Darren who could really inform our practice and just contribute in this just magic way. And sometimes it's just like finding the nook and then the next nook and then the little ladder, and then suddenly we find ourselves doing the art strategy for a massive new build. So I wonder if it's about these, you know, smaller goals lead to something bigger. You know, now we've got the partnership with you guys at Norwich University of the Arts. It's helping us with our research, with our evidence. Suddenly we might be able to say to that person, here's the evidence. You know, before we couldn't say that. So I don't know, I'm all about the kind of scrappiness.
And breaking rules. We need to break rules. Why are they there?
Can I just add very quickly that, first of all, I think Neve's absolutely right. And this is going to be self-contradictory. When I was listening to Simon's fantastic presentation, I was thinking about Finsbury, which I thought about often, and what an absolutely amazing thing it was. And why isn't Finsbury everywhere? Why are we what we are in 2020? And that feels quite defeatist, that they knew what they were doing in 1938. And yet we see acres of bad practice and things not happening. However, I was going to be positive. I think overall, at the moment, the wind is in our favour. There is greater recognition about the benefits of and importance of creativity in all our lives, including in mental health. It's a massive battle. It's extremely uphill. It's at a time of tremendous difficulty, but certainly amongst art funders, I think that there definitely has been a shift. We're part of that, but there's a much bigger shift, which is only partial, and we've seen it come and go in the past, but even so, I think things are being valued and more respected quite recently.
Okay, thank you. We've got a number of other questions around the extent to which new doctors are involved in the projects, about ingredients for successful collaboration. There's lots of really interesting points coming through the question and answer, and loads of observations that are positive. I'm going to pause there so that we have our 10-minute break is now down to 8 minutes. So we have a comfort break before the second section, and some of the questions that Caroline and Annabelle and others have asked, I will come back to. Thank you for your questions and thanks for all your comments. We'll come back to that in the second panel session, and there will be there's some questions, more questions for Tim and Neve, particularly who may have to join that session as well, hopefully. So thank you. Can I thank everyone who's presented this morning? Thank you, Darren, as well, for coming into the panel. And so we'll now take a 7-minute comfort break and return for the second half of the symposium at 1 o'clock with our second keynote speaker. So see you all in perhaps 6.5 minutes now. Hello everyone, welcome back, and thanks for joining us again. Our next keynote speaker is Dr. Clive Parkinson, who's Director of Arts for Health at Manchester Metropolitan University. Clive's presentation is called Untethered. Thank you, Clive. Thanks for joining us.
The boy's in pain, Martin. Yes. And you can take it away. Yes. Then that has to be enough for you.
All right. I'll take it away. What then? He'd feel himself acceptable. What then? Do you think feelings like his can be simply reattached, like plasters stuck on other objects we select? I mean, look at him. My desire might be to make of this boy an ardent husband, a caring citizen, a worshipper of abstract and unifying God. My achievement, however, is more likely to make a ghost.
Here's the thing. I've not been feeling so well. I don't mean my mind as such, but my aging body and the first flickering signs of its mortality. Lifted off my feet by some unseasonable breeze, I've been snagged up on a pylon for some time. Untethered for a while, my clothes inevitably torn, until I'm blown back delicately to terra firma, some clarity, some confusion. But I'm going off track. So, I was walking out through the night, up on the edges of the backwater northern town that I call home, down in the shadows of the slaughterhouse, the municipal cemetery, the prison, and the old county asylum. And down a snicket, a ginnel, an alley, the streetlight starts stuttering, on, off, on, off. Might walking under this thing trigger me in some way? Not like some fragile and oversensitive Instagrammer, but something darker, hidden away, just waiting to be suckered out. All those cultivated recesses, the ridges and grooves and private places where things have been stashed away deep down in my paleo-mammalian cortex. How do I avoid the urge to count out the beats, the mantra, the gibberish, the 1, 2, 3, when my body's failing? And in truth, I'm so vulnerable. Maybe it might offer a bit of reassurance to me, a little comfort perhaps. In the blink of an eye, I whip out my phone and start to film it, to control it, displacing the twitching anxiety by capturing it. So that's just what I do. I put the genie in the bottle or transform it into something else. This is what I give you today. Some thoughts on making sense of riddles, truth and lies through these cold, tail-end days of my pandemic winter. A story, or a song, or a research-informed polemic. A little learning from the past to inform the future. Some days later, higher in the hills that surround this town, the snow descends quick and thick. It's cold, and I feel alive. I'm thinking about Captain Oates on his ill-fated polar expedition. Scott of the Antarctic didn't plan so well and was beaten by a better-prepared explorer. Oates' famous last words as he walked out onto the Ross Ice Shelf. I'm just going outside, and maybe sometime. Stumbling down the hills through something almost like a whiteout, that old asylum, the Moor Hospital for the lunatics and the northern counties, looms into my view, emerges from the blizzard, a constant reminder of my brother. My time in his shadow and our degrees of shared disquiet. 20th century victims of the well-intended and of the architecture of the moral treatment of the 19th century. Those Victorians certainly knew how to build big, and often gazing up into its shiny black windows, I see the pale ghosts of people looking down at me. The patients, the workers, sallow faces and shell-shocked eyes. At home, I warm myself up and plan something that's of vague use for today, about just what it might be that the arts offer up to people in existential crisis. But I'm cautious because as this pandemic deals its vicious sideswipes to body and mind alike, there's a creeping danger that all those real anxieties that we feel will be twisted into some bleak pathology a deficit that hangs heavy around our necks and clouds our minds. So in search of gold and shining truths of empirical knowledge, I convene a small séance in the back parlour of our house, and in the hands of relative strangers, I'm suckered into a feverish reverie to better understand what it is we desire through some conjunction of the arts and all our mental health. I'm flooded by old-time enlightened mutton shop entrepreneurs, Victorians, Edwardians, experimental trussed-up pale-faced men excited to fever pitch. I'm privy to fractured sensate moments of others' lives, images, imaginings, sounds and tastes. They crowd me out, and there, a giant of a man recently returned from his colonial explorations of South Africa is slumped in a bath, alabaster legs dangling over the sides. Francis Galton, polymath, explorer, statistician. Like the ferns and flowers pressed in albums or studied under microscopes, this 19th century intellectual began to see the necessity of creating apparently objective taxonomies of the human terrain and of difference. Bloated and naked, Galton is lying under the water, his face puced with exertion or sunstroke. Above him, he holds his hands a newspaper, all the while attempting to read it from underneath the water. A woman, the scientist's wife, Louisa Jane, whispers in my ear, "He will control every breath, make it a conscious act. He will subjugate the body's automatic acts, make every breath a conscious undertaking." An improbable, gnawing time passes, and he bursts out of the water, coughing, spluttering, and raving. Louisa Jane's pride spreads into me like a warmth as he falls to the floor, marine mammal corpse white, as she flits away to tend to her man. I hear his mind racing. Too much, too much, too much, breaking down, breaking down. Another voice, let's call him Mark, perhaps my spirit guide, whispers, "Science is what one deliberately does. Obsession is what one can't help doing, a distinction that collapses frequently. Height, weight, strength, perception of colour, breathing power, highest audible sounds, all are measurable lives. In 1885, anthropometric laboratory, Galton measured 10,000 individuals with over 150,000 separate measurements, crunching large-scale human data and finding patterns, objectification, standardization, cultural myopia. In his study, Hereditary Genius, an inquiry into laws and consequences, he set out to measure the frequency of eminence amongst the offspring of illustrious parents as compared to the general population. He compared the children of judges, statesmen, scientists against the masses. His conclusion, the offspring of the illustrious were more likely to be illustrious than the children of the non-illustrious. Observations of outcomes devoid of deep context. That thinking around human heredity would go on to influence the field of eugenics and all the unfolding 20th century horrors that playing the white god of science brought. A soft hand leads me to a drawing room where a ruddy-cheeked and foppish man sings great Wagnerian bursts of energy floating from his mouth, as a small lad plays with the chemistry set on the floor. Bright colours and flames illuminate his face as young Emile Kraepelin pours his mixtures of black bile, yellow bile, blood and phlegm, his eyes alive with the distilled possibilities of human essence and failure. Sing songs, tell stories, his father, a born artist, laughs, but young Emile turns his back. Thoughts of weakness, degeneracy and drunkenness rattle around his young mind. Mark whispers so as not to upset the scene. That boy and Galton could be brothers, don't you think? Looking at the very roots of inferiority and moral insanity, his works will help identify the feeble-minded, born criminals, queers, drunks and reprobates. He imagines a purer country and will map out the human mind and all its chemically driven disease. He'll crack open natural selection and make his country great. Mark reminds me that soon enough, the great wars will come, and that out of them will emerge a birth of great culture and thinking on our little island, and an alchemy where the arts and science might meet. He warns me less of the tragic atrocities of war, but rather the insidious power of market forces and the radical thinkers and other kinds of cultural wars where disquiet was fermenting. The economist John Maynard Keynes celebrated and invested in the encouragement of music and the arts with some kind of social purpose, pitted against another who celebrated Galton and equated humans with profit and loss. Any value that can't be expressed as a price decided by the market, little Friedrich Hayek suggested, was nothing more than subjective opinion and preference, worse still, folklore and superstition. Friedrich threw tasty morsels on the floor of the universal market, which in time Thatcher and Reagan would gobble up, exposing all our mental health to the free market and endemic inequalities. Though Hayek is strangely quiet in this spirit world, Keynes glares out at the void and decries it is an extraordinary example of how, starting with a mistake, a remorseless logician can end in bedlam. In some other olden-day bedroom, a smelly yellow light illuminates everything as a pale and drawn woman slumps over her desk, while another, on all fours, crawls the locked room, scratching its four walls to release something. They are Gilman, the artist, my guide tells me, forced to take rest and never touch a pencil, a pen or a brush. Her doctor prescribes just 2 hours of any mental stimulation each day. Charlotte's voice was too loud. She became hysterical, and her doctor, well, he knows best. Sing songs, tell stories, Krapelin's father butts in. Have you shown him little Billy? He asks. And there she is, another country, another continent, this young African-American woman facing unbearable blind hate, physical and emotional trauma, but stamping out her own path through song. Lady Day, Billie Holiday, singing some reality I can't imagine, body abused, personhood eroded, victimized by the state, mind calmed through artistry, drink and drugs, her voice shimmering through time. I'm sweating at all these others' realities. But then, impoverished Billie is sedated and cuffed to a hospital bed, and her light flickers out. State-sanctioned torture. My whisperer holds on to me, can feel me shaking. Perhaps you should meet the lady with the lamp, patron saint of arts and mental health. I sense him smiling. But no, not that one. Mary Barnes, Second World War nurse and painter of the filthiest of things. In broken down rooms down in Bromley by Bow, the artist is amongst friends, making sense of all the things in their lives, the troubles and the good stuff, painted in shit and created in passion. It's not long before she's splashing paint and expanding her desire to create, but oh, she wants to cradle her brother. The flawed scientist took her in, let her breathe, let her flower again. Now she's the nurse again, the educator, the artist, the activist. And poets and curators, writers feel her worth, her value, not weighed out in pounds, shillings and pence, but in deeper knowledge of her lived experience. It's 4:48 a.m, Mark tells me. Your time's running out here, Clive. Here's the fella who stuck his neck out, maybe all ego, booze and drugs, but think about him for a minute and then go tell your story. We're just in time for Dr. Lang, product of the times, lambasting authority, family, the status quo, but we might learn a little from the past to help inform these futures.
Dr. Lang, right. This is one of the largest crowds we've had here for a speaker. Yet I feel we've been presented with a fumbling, rambling performance I would like to ask, is this some social experiment? Is this something by example you're showing us? Or is this merely an example of the high stature you have for yourself and that you're presenting us with any old rotten baggage and expect us to applaud? Could you comment?
Well, I imagine that you're culturally conditioned to get a very different sort of talk. And that what you're conditioned to get is a pretty fast rap by someone who has worked out what they're going to say in advance and presents it in a particular way where the connections between one sentence and the next and one, as it were, paragraph in the next, and which has got a sort of beginning and a middle and an end that you can recognize. This has been taped by quite a number of people, and I would suggest that before you have the presumption and the fucking cheek to come on in that way, that you consider that you listen to it again, and then you might discover that there's more method in what I said and more organization in what I've said than you have been able to hear.
I'm unsure who my spirit guide has been as I stumble back into the room, back into Zoom, back in front of all your eyes. That old asylum in Lancaster, now designer apartments for a different kind of gated community. Well, when my brother unravelled as a young man, it offered him some restraint from his free-flowing thinking and painful troughs of depression and fear. My brother Mark, beaten down and drained of aspiration, bleary-eyed and dulled, unable to think coherently through the most unpalatable cocktails. It certainly dealt with the symptoms he expressed, but God, all the stuff that unfolded across his life leading up to these stays in hospital. Yet the shame and the blame he felt was legion, in a place where everybody's qualified opinion of his life was more valuable than his own.
We live in difficult times, but we just don't know how the anxieties and traumas that this last year has thrown at us will pan out. Mental health issues are centred in the brain, but perhaps too, they're centred in society, in our families, our communities, the schools we go to, and the politics that govern us. Clinical psychologist Peter Kinderman suggests we should drop the language of disorder and start by acknowledging that distress is normal, not abnormal part of human life, that humans respond to difficult circumstances by becoming stressed. The death of someone we love can lead to a profound and long-lasting grieving process. In what sense is it a disorder, he asks, if we remain distressed by bereavement after 3 months? Kinderman suggests that diagnoses are often used as a pseudo-explanation for troubling behaviours. For example, he did this because he's got schizophrenia. There's no consideration of the circularity of that argument and the broader context, excluding any possibility of finding meaning in people's disordered responses and experiences, preventing people from understanding how they might use their own resources to address their difficulties. Kinderman tells us that those psychosocial factors like poverty, unemployment, and trauma are the most strongly evidenced causal factors for psychological distress. Other factors, genetic and developmental, influence the magnitude of the individual's reaction to these circumstances. We know more people are experiencing stress, anxiety, and trauma because of the pandemic. Reports of an approaching tsunami, however, seem to be the lazy shorthand of journalism. Informed voices are changing the doom-laden narrative. Particularly insightful are the observations of the professor of clinical psychology, Richard Bentel, who suggests that with all its bleak implications, this narrative carries the risks of becoming a self-fulfilling prophecy. I quote him, "We know from previous research that individuals' interpersonal traumas, for example, sexual assault, are far more mentally damaging than collective traumas such as natural disasters. This, at least, is in part because strong social bonds protect people against stress, and during a crisis, people often come together, help each other, create a sense of belonging and a shared identity with neighbours. His research suggests, however, that it's economic threats related to the pandemic which are most linked with symptoms of mental ill health. Where mental illness is seen as an individual biochemical problem, this has huge benefits for the free market. It pushes the idea of apportioning blame on the individual, reinforcing that it's your personal chemistry that's wrong, feeding the burgeoning pharmaceutical industry, which in turn is great for the economy. Perhaps these same medications contribute to the creation of a passive and compliant workforce too. Toxic capitalist policies and culture stoke the aspirations and expectations of our entrepreneurial and delusions societies, persuading the masses that we can all be the next Kim Kardashian, Bill Gates, or Donald Trump. By reinforcing the belief that material affluence is the key to fulfillment, we're spoon-fed the idea that access to the top is open to anyone willing to work hard enough, regardless of their family, ethnic, or social backgrounds. So if you don't succeed, there's only one person to blame. This is a toxic mix that is poisonous to our well-being. Author and educator, and another Mark, perhaps my spirit guide, Mark Fisher, was a small-scale giant thinker who had written about his own depression candidly, arguing that mental anguish can't be properly understood or healed if viewed as a private problem suffered by damaged individuals. The pandemic seems to have made us all more emotionally intelligent about our mental health. People are talking about the issues. But just as much as digital connectivity might help us, it might also contribute to us becoming more introspective, closed off, speaking only with those in our spheres of interest. What has the appearance of being public and considered is in fact only an extension of our own pre-existing opinions, prejudices, and beliefs, a gamifying of the self played out in an echo chamber. Social media brings us together and divides us, quantifying our social standing and intensifying social comparison to the point at which, having consumed everything else, we start to prey upon ourselves, our inadequacies, our vulnerabilities, and our loneliness. And when it all goes wrong, its losers are rejected from the group, with terrible personal consequences. We've been marketed an image of constant perfection, which doesn't exist physically or mentally. In a world where morality has been replaced by feeling, our feelings are increasingly mediated by social media, and we all feel like the invisible actor at the center of the world. And there's a worry too, that we might begin to define ourselves through deficit, turning everyday suffering into a symptom into a disease, and disease into a condition to be cured. And imagining things differently is difficult. The dominance of neoliberalism seems to stifle opportunity for imagination and resistance, diminishing and negating the lived experience of people marginalized through difference or disability. Fisher suggests that we should convert widespread mental health problems from medicalized conditions into effective antagonisms. What might he mean? On hearing that he's about to be fired because of dwindling TV figures, news anchorman, played by Peter Finch in the 1976 film Network, has a monumental televised mental breakdown. Here's my slightly adapted version. We know things are bad, worse than bad. They're crazy. It's like everything everywhere is going crazy. So we don't want to go out anymore. We sit in the house and slowly the world we're living is getting smaller. And all we say is, please, at least leave us alone in our rooms. Let me have a laptop and my iPhone and my social media. And I won't say anything. Just leave us alone. Well, I'm not going to leave you alone. I want you to get mad. I don't want you to pretend. I don't want you to riot. I don't want you to write to your politicians because I wouldn't know what to tell you to write. I don't know what to do about the depression and the pandemic and unemployment and crime on the street. All I know is that first you've got to get mad. You've got to say, I'm a human being, God damn it. My life has value. Effective antagonisms. Finch is inciting people watching his breakdown to go out into the streets and express their shared discomfort. And that's important. It's shared. It's not just being an individual. But Fisher also suggests that the most powerful forms of desire are precisely cravings for the strange, the unexpected, which can only be supplied by artists and those who are prepared to give people something different from which already satisfies them, by those prepared to take a certain kind of risk, taking people beyond the limits of their own self. Researchers are out there revealing those links between participation in the arts in all their forms on our mental health and well-being. They're exploring how deep immersion in our own creativity might reduce that cortisol rush that rages around our veins, wreaking its havoc. Artists offer us work that goes deeper than simple distraction, offering both solace and arousal. Beyond that gentle, mindful state, there exists too a more adrenalized passion that is appropriate and motivational, the desire to make changes and yes, get angry, but to do something constructive with that disquiet. The world has known some great visionaries, ghosts of the past, who can teach us ways into the future where the voices of the routinely marginalized are liberated and put up front. So perhaps research might not all be about evidence in the clinical or the economic outcomes of art, but more oblique evidences of existential exploration that the arts bring. Exposing ourselves to other realities, new ways of thinking, being and doing, and challenging the norms. Lived experience, it's a term I hear a lot and understand, but let's go beyond token conversations and dive deeper into the curated chaos that the arts sometimes open up. We are an exquisite corpse, an organism connected through the soil and the sky, the flora and the fauna, and all our shared imagination. David talked earlier about complexity. Well, let's embrace this complexity. It's central to what art does, what art offers, what creativity exposes us to. I'm going to end my presentation there. This is my research-informed polemic. Thank you.
Thank you, Clive. Fantastic. Lots there for rich and condensed. Lots for reflection, including Ronnie Lang's critique of all our other presentations slipped in there, which is good. Thank you. I'm sure we'll come back to. Hope we come back to a lot of those points, although I'm sure we won't be able to get through all of those themes this afternoon. And now we're going to hear a series of presentations from artists who are involved in the Northside House project, which you've heard is currently underway. Although the project has been stop-start since the project started in March last year, for reasons you'll all be familiar with. We'll start with Kara Nahal, who's one of the artists on the project, as I mentioned, who's undertaken a workshop that I was pleased to be able to attend. Thank you, Kara.
Thank you, Simon, for the introduction, and thanks everyone for coming to the talk. When Hospital Rooms got in touch with me about the Northside project, I was really excited. Both my parents, they immigrated to the UK in the 70s to work as nurses for the NHS, and they both worked on mental health units for over 30 years. So this opportunity had a very personal resonance for me. I'm going to share some slides. Sorry about that. Okay. So I've taken a lot of inspiration from how other artists have responded to other Hospital Rooms project, and it's been wonderful to see how varied and diverse each response has been. And I think Hospital Rooms have created a really interesting way to think about the relationship between art and physical and mental health. And as an artist, I think this is inherent to most art practices, even if not immediately obvious. So I saw the Northside project as an opportunity to more closely combine the two. So I'd like to talk about my proposal for Northside, as well as the workshop I led last year, but I wanted to start by giving a very brief introduction to my work so you can get an idea of how I came up with ideas for both. So I'm a painter, and my work is about how landscapes and interiors can become sites to reflect upon memory and identity. The paintings I make are based on my childhood visits to my parents' home countries of Malaysia and Mauritius, and the feelings of longing to revisit them, but through my imagination. And so colour plays a really important part in my work, and last year in an exhibition, I wanted to take this further outside of my paintings into the gallery itself. And I've been thinking a lot about how colour is a deeply personal language and how it can be used in a very simple way to transform a whole space. And I tend to use colours which are bright or even intense as a way to think about how we can also travel through colour. I also paint a lot of windows in my work, and within this particular gallery space you can see here, there was a window opening onto a courtyard which looked like an image that I would paint. So I used this green wall I painted as a way to create another painting of this frame view within the overall space. So going into Northside, I knew that using colour and referencing windows somehow would be an important element for developing my proposal for the project. So I was fortunate to visit Northside in December last year, and I'm really glad I got the chance to explore some of my initial thoughts. And for the workshop, my first idea was to do a painting or drawing workshop, but what I really wanted to explore was colour and landscape in a more abstracted way. And I think with painting or drawing, there's a tendency to try and recreate exactly what's in front of you, but that's not what I really wanted to look at. So I went with a collage workshop, and I worked with the hospital rooms team, the patients, and the staff to make these memory landscapes using coloured cards and some shapes that I previously cut out before the workshop. So I incorporated some of the shapes and elements that I use in my own paintings to see which particular shapes and colours people were drawn to, and so I could somehow use these in my proposal. And it was really important for me to get to know the people in the unit and get a sense of how they felt about the work, and staff too, as they obviously spend a lot of time there. And so both of these were important factors that really shaped my ideas. Before the workshop, we were kindly given a short tour of Northside, which was really insightful, especially looking closely at the spaces in which they wanted artists to respond to. And it felt like, although much of the architecture had been carefully considered, the ways in which some of the rooms were decorated seemed somewhat counterintuitive. And so as an artist who is used to making work to be displayed in a gallery, I found the shift in brief quite substantial. And I wanted to make sure that whatever I ended up creating would be held up to a different type of scrutiny. So I think I knew quite early on that simply hanging paintings within a space wouldn't have a significant enough impact, and that the most useful thing I could do would be to transform the space as a whole. And so I was shown a recreation room which had a window overlooking the hospital grounds, and I knew this could be a space where I could create something uplifting for the occupants, but also try and bring a sense of warmth and softness to the room that felt more like a domestic space. And I felt, well, I found putting the needs of the occupants first, it felt almost like a design brief rather than sort of my typical working methods as an artist, but it was also really refreshing. I liked thinking about creating an artwork with the same level of care and attention as I would for an exhibition. And so I tried to put myself in the position of someone living there day to day and thinking a lot about how tethered to the space they were. And so I've created an idea for a mural to span the whole of the space, which will depict a tropical landscape in a mixture of bright and subdued yellow colours. And I've also played with the window and included an arch to reference some of the shapes that were used in the workshop. I wanted to have a feeling of vibrancy and joyfulness in the composition, something that might stimulate the imagination, but also take people beyond their physical reality. And I was also very drawn to the window again, and I wanted to acknowledge the view in a way that didn't retract from the window, but accentuated it. I have some experience in creating large wall paintings, and I enjoy how the scale of them relates to the whole body as opposed to just sort of your eye level view. And I want the painting to feel immersive, but also like a haven, as I know that the room is a quiet space, so I think it's important to retain that sense of peacefulness. So I hope that the end results will emphasize some of the room's pre-existing qualities. Yeah, luckily it looks like the project's back up and running soon, so I'm really looking forward to going back to Northside and to get started on the mural. And I also just wanted to say a quick thank you to everyone who has been working on this project and to the university for putting this talk together. It's been a really amazing thing to be part of, so thank you. Thank you, Cara. Thanks for that. I agree. It'd be great to see your work when it's installed, when we can get back into Northside House. And you can install the work, and it'd be wonderful to see it in situ when it's finished. Next artist is Jade Monsterat, who is actually a graduate of NUA's master's program, and is now, as well as being a very successful artist, is undertaking a PhD at the Institute for Black Atlantic Research at the University of Central Lancashire. Thank you, Jade.
Thank you. Thank you all for this invitation, and thank you to the speakers. I've managed to hear just now. I have put into the chat a link to a film I made last year with my collaborators, Webb Ellis. And it's just a suggestion that you might like to view that simultaneously as I speak, because I never feel that confident really about sharing my screen and stuff. So I want to just present a content warning that I will be talking about trauma and suicide. But in the first instance, I'm going to talk briefly about my relationship to charcoal, my relationship, and I've got a beautiful box here that I can show off, that's willow. My relationship to with drawing and text and performance, and some of the influences in my life and research that help me as I continue to think about a drawing praxis, that is an expanded idea of drawing. And I can also recommend a companion guide to contemporary drawing, recently published, and the editors are Kelly Chorpen-Yung and Rebecca Fortnum. And some of what I will speak about comes from my thinking and writing from that I'll speak about now. So last Friday saw the first of 2 workshops that I'm running with Hospital Fields in Arbroath, the concluding workshop of which is this Friday. We sent charcoal packages to all participants in advance of last week's workshop. We connected with students at Duncan Jordanston College of Art and Design and Gray's School of Art, and also the University of California, Santa Cruz. Given my developing relationship with Alexandra Moore there, who is a PhD candidate, lecturer and curator, and who is also writing about my work in their thesis. She's curated an extraordinary looking exhibition around abolition, which I'll try and Google after this and put into the chat. Alexandra collected with Melody and Vince, who made charcoal for the participants stateside last weekend, or so ago, who were taking part in the workshops. And I'm going to briefly read from Melody's beautiful letter explaining to me and Alexandra the process her and Vince undertook and the implications of it. Together we foraged local place-based materials. We gathered the wood in such a way that is respectful to the plants, taking an approach to pruning the trees that is generative and helps them to grow stronger. The materials are sourced from traditional Awaswas territory, which is presently tended by the Ama Mutsun tribal band. We live in a floodplain alongside the local river in town. The river is colonially known as the San Lorenzo River, named by violent settlers at the onslaught of European colonization within this region. The river is a complex site with a mixture of deep beauty and destruction, evidenced by the mixture of both native and non-native plants. The changes in fish and wildlife populations, and so on. This river is the primary source of much of the city's water. We gathered native species of willow and coastal redwood, as well as one non-native species of olive wood. We loved that each type of wood, though often subtle, can impart a different quality and richness of mark making. The bundles each contain 8 or so pieces of charcoal, 4 pieces of willow, 2 pieces of coastal redwood, 1 piece of olive, and 1 piece of native pine, charred by wildfire. The wildfire charred pine wood was harvested from a tree that had fallen due to its core erupting in fire and was harvested from along what is known as Swanton Road. The pine wood was charred by recent fires that were sparked by a dry lightning event that has burnt across 85,000 acres of sacred land. We want to acknowledge that the scale and intensity of this fire is directly connected to colonization, the disruption of traditional indigenous cultural stewardship, and the ongoing complications that propel and exacerbate climate change. That's thanks to Melody. Like our workshop, like the hospital rooms and my workshop scheduled for next week at Northside House, participants in this workshop will be guided to relax into drawing. I assert that there is a connection between ourselves and the earth. This line or connection, like our communications with one another, is drawing. In this workshop, I am seeking to visualize together exchanges of energy, lines, communication, and with that, consider stewarding of our spaces. Charcoal is used to mediate relations between drawing, text, and performance. The use of recycled or found materials is encouraged. A central focus of the workshop will be to think and draw beyond paper and consider conceptual, performative, and site-specific drawing, listening, and conversation. I struggle to find the boundary between writing and drawing, which perhaps is something to do with language. So many people talk about drawing figuratively, that is, drawing out, drawing from, drawing with. And I think as an idea that that's really what my performance or my workshops are about, because it's not conventional drawing, but it's using the tools of traditional conventional drawing. It becomes useful to think of drawing as a mode of being or a mode of operating, because I think that it's kind of forgiving. The reason I have been able to arrive at an idea of drawing as an expanded process is because I've gone through a certain type of education, all of which has been discussed wonderfully by Clive Parkinson earlier. But yeah, observational drawing, drawing with charcoal. Although I'm saying drawing is democratic and generative and has these possibilities, in practice it doesn't work unless we're all up to speed with the idea that creativity can happen at any point, which is what I'm understanding Hospital Rooms advocates. I think that the potentials of drawing are opened up through language and the way most people think about drawing out as a way of thinking through something and actioning or a movement. I'm arriving at this formulation that drawing is more like performance. We're leaving a trace, and that trace can be a conversation. I find it difficult to divorce writing from drawing because they both demonstrate how we interact with one another. I'm seeing that there's a connection between us all. Through dialoguing, there's a line, there's a thread. And if one's thinking is informed by an ethics focused on human rights or sustainability, it allows a certain freedom. All the things that maybe could be embarrassing or risky can be overcome, because I see drawing almost as a formal way of approaching my art practice. Thinking of drawing in that way allows me to feel creative and take every experience as a valuable experience and be quite present in each situation, or at least that's the hope. Drawing is something that we're taught to do in school. It's something that we do as a child. It's accessible. So it allows me to be thinking about democracy and speaking on layman's terms. It doesn't need to be art. Through drawing, we're mapping, editing, tracing something. I'm also making an appeal that no drawing, sorry, I saw something come up in the chat, which I'll look in now. But because I sense of doing things wrong is what limits everyone's access, not just to the spaces for creativity, but also to our potential for creativity. It's like we can unlearn creativity. And so when I perform the spoken element of No Need for Clothing, there are pauses. I breathe in and out for 3 seconds. It isn't showy, but I pause and breathe so that I can keep going for the remaining time. I sometimes think about how we unlearn to breathe fully. And it wasn't until I went to yoga that I was taught again how to breathe into my tummy so that it expands, and then to breathe out again. I think we put limits on our imagination similarly, because we're breathing in this constant state of suspense or anxiety that this world creates around us. And I'll just finish by reading from a text that will soon be published as a PDF and was written in collaboration with Nikita Gill, curator in training, working with me on the Future Collect project that is supported by Manchester Art Gallery, Innova and the Art Fund. The text was commissioned by Bethlehem Gallery and takes its cue from Mark Titchener's work, also featuring in my current exhibition in Manchester called Constellations, Care and Resistance. We divided the text, so the first part is titled Inside and was written by Gill, and the second half Outside, written by myself, Outside. 5 or 6 weeks before the opening of Constellations, Care and Resistance, I was sectioned by the Mental Health Act. My white friends had called the emergency services, concerned for my welfare. The situation immediately escalated on the arrival of just the police. My emotional state, particularly my response to the affirmative to their question as to whether I felt suicidal, was met with resistance. I was restrained by multiple officers. I explained I was finding the process terrifying and recognized their behavior as part of a longer history that is symptomatic of structural racism. I made comment that racism is a public health crisis, emphasizing that force as a method is an inherent tactic of white supremacy. These vocalizations were inevitably met with antagonized defense. Racism does not exist. Let go of all things eating you up. I requested the code of practice at the facility I was then detained at, which took 3 hours to find. Imagining Mark Titchener's mirrored public realm version of some questions about us, I'm confronted by myself mired in the sterility of bureaucratic doublespeak. Some questions, were I to read them on their mirrored surface, asks how it might be that we find ourselves complicit in obfuscation and injustices. Some questions queries autonomy and asks that those easily ignored assessments determining what level of care one might receive involuntarily are read and known to the reader. The municipal space version of some questions, in being seen by all different types of people passing by, must almost also account pleasingly for the fact that all different types of people will also be seen by the artwork, emphasizing ideas around mirroring and being seen, and vitally taking time to reflect. How some questions is received is dependent on how the questions reflect the viewer's innermost fears, assumptions, or concern for others. For some, I imagine, immunity from such concerns will be considered guaranteed. I think of Sarah Reid, a Black woman with a history of mental ill health who was confined, segregated and punished by Black authorities, and how citizens communicate distress and abuse while detained and in care. Sarah Reid was found dead in her cell at Holloway Prison 5 years ago. Under existing conditions whereby trauma is met with traumatizing behavior and violent care systems, Sarah Reid simply didn't stand a chance. I thankfully caught only a glimpse of enforced care last year, confirming the tyranny brought about by the rule of nobody, as Hannah Arendt described, of the violence brought about by bureaucracy. Thank you for listening to my presentation.
Thank you, Jade. Powerful stuff. And I know there's a lot of excitement about your workshop next week. The next speaker is Richard Wentworth, another artist who we're privileged to have working on the North Side House project. Thank you, Richard.
Hello to everybody. You can hear me now.
Yes, we can hear you.
Yeah, good. Sorry to be like that. I'm in a 2 Zoom household, so the day is more complicated than I imagined. Even more complicated to follow Jade. I'm actually a rather lachrymose man and can burst into tears at the most surprising moments. I have no presentation to make in the sense that I'm not planning to show you work, but I did want to, in a way, celebrate what I've experienced very directly through Tim and Neve and Phoebe, and if I start naming everybody, we'll be here all the time, but to really everybody involved in involving me. I think artists are incredibly lonely, and this year we've been given time to think about how alone and lonely and lonesome join up, no matter who we are or what our circumstances might have been. And of course, I've recognized how deeply gregarious I am. I live in London and I've been there for 65 years and I need it. I don't suppose it needs me, but I need it. There are odd moments when one's loneliness, or dare I say it, privacy, are punctuated in a very good way. And I think the invitation to go to Hellingly with Tim and Neve is conspicuous for that. So I, in a way, would like to just describe the powers of their brokerage. They don't use, well, they are very sophisticated people, but they don't use, dare I say it, professional language. And they have very unusual powers. I think I could only really call them diplomatic powers. And I think when you're with them, certainly in my case, I become even more childish than I already am. So I feel at ease. I feel, dare I say it, looked after. But that could be a smart way of saying managed. And I definitely feel the strength of the in the word invitation. And so I've spent God knows how many hours with them, but a lot of that is on trains and in cabs. And there's a sort of energy that we, of course, are all missing, where that space allows for eventuality. There are probably other people in the group, so there might be a dynamic of half a dozen people, conversations hither and thither, very interesting spatial questions about where anyone might sit and who that means they're with. Chaucer stuff, I guess, you know, who you fall into step with. So by the time, for instance, on my first visit to Hellingly, I was in some way sort of strangely at ease, whilst feeling right inside for all sorts of, but you know, the sources of personal experience of different kinds, considerable anxiety. But then, of course, I realized that Tim and Neve and the people that work with them are already in a dynamic relationship with people at Hellingly, both patients and professional staff. So what I'm really trying to emphasize is that the enormous sense of institution was so magically diminished. And I think a lot of what we're all talking about today are institutions which are physically identifiable, as well as all the countless abstract ones that are in all our relations and in our politics with a small p. I think it's worth saying that the extraordinarily unfortunate term public art is quite a thing to put round anybody's neck. You know, there were 2 wars, for instance, that affected this island, and there are war memorials, I think, everywhere except for 5 villages. That is, however you look at it, is a kind of definitive public art of its time. So I think being asked to leave the absurdity of one's private space to go into a public realm, but actually a very sequestered public realm, and perform usefully, is incredibly demanding and a very, very, really difficult thing to do. And I wouldn't hold up what I did at Hellingly as being the better or worse than anybody else's. It's, if you like, what I could do. But I think I could say what drove it, and what drove it really was a profound sense of what architecture is. So architecture really is not much more than what we now call social distancing. It's how close or how far are you to be from another human, and in what circumstances. And since I'm speaking in a big storm that involves things like temperature and probably our learned need not to get wet and keep dry. And I loved whoever said magnolia. I thought that the Vonnegut piece should be stenciled on a wall. I mean, I nearly knew him, so I was sort of irritated at never having made anything of the opportunity. But I mean, what a brilliant piece of writing. And then whoever said magnolia, and this is a magnolia culture. I suppose that's a sort of, could be a Terence Conran joke. But really, in the big sense, I think we are in such trouble architecturally. And I mean that with a very small a. How we encounter each other, how we feel enabled or disabled by the space that we're in, and the effect we have on others and they have on us, and so on. I mean, it's the biggest subject there is to me. And it's what I think about daily. That's not about architecture school, it's about little architecture. So if I can go on being useful to hospital rooms, it would be to bring that whole question of the built and the safe and the supportive and valuing space much more into focus. Thank you very much indeed.
Thank you, Richard. Really interesting. I think that point about architecture and particularly how physical spaces construct and control forms of behaviour is a theme of these projects. And particularly also how professions are siloed in their knowledges and skills, and how difficult it is for collaborations across some of those professions. I think somebody I used to work with, David Cross, once said that he thought, he's an artist, he thought that fine art practice was a solvent to dissolve the barriers between subjects and knowledges, which I always thought was a wonderful image. Our next artist is Carl Rowe, who's Associate Professor and Course Leader of Fine Art at Norwich University of the Arts and a valued colleague, and is also an artist on the Northside House project. Thank you, Carl.
Thank you, Simon. And it does seem like a time to thank people. So I do desperately want to thank Tim and Neve and the whole of Hospital Rooms, because they are absolutely brilliant. And I do count myself as being very lucky for working at Norwich School of Art and Design, or Norwich University of the Arts, sorry, there you go. I think it's an art school. But I know that some of the students that I teach have enrolled on this webinar as well. So I want to thank them for their interest. It's quite fascinating how students are becoming very concerned with the possibility for art and creativity to become part of a sort of a reconstruction of all of the problems that we've got in society. So I find that very fascinating. Okay, so when I was first asked by Tim and Neve if I would be interested in working on the Northside House project, I was working on this series of work. So we're going back to 2018, 2019, these paintings that have geometric forms and structures in them that seem quite random, but might have associations, rather maybe worrying associations of gaseous particles and kind of substances that that we could associate with the pandemic, although these were all produced before that time. So like everyone, come March, I had in my mind the Northside House projects, and come March, I found myself walking for 1 hour across a field that started off being quite stubbly. And so my mind, I don't think I was thinking about art at all at this point, but what I kept finding in this field with these little tubes that I seem to remember finding as a child and thinking they were small bones, until I realized that they were clay pipes. So on the right hand side there, you can see the sorts of things I was doing. So sort of March, April, May, just assembling these found objects. So when I was able to get back into the studio in August, and I was thinking about the Northside House project, this is the first thing that I'll be working on, hopefully. I didn't know where to start. I don't know if other people felt that way, but the studio felt strangely cold to me. I really didn't know where to pick things up. So I was making these little drawings and paintings, and they were fine, but I felt they were really tight. So I did what I would be telling students to do, to throw it all up in the air, start getting active, start doing something that you feel maybe uncomfortable with or makes you laugh. The piece that I made on the right-hand side there, that made me laugh. When I nearly fell off the chair taking the photograph, that nearly made me cry. Then I cut the whole thing up and felt a little bit better about what I was doing, although I didn't quite know what it was. You can see the top there, the first post-lockdown watercolors that I did, that I've just left. They're fine. I'm not going to do anything with them. I'm not going to cut them up. But making this big collage piece sort of set me off thinking, yes, I've been interested in collage for so long. I love the work of Hannah Hock, of Romari Bearden, of John Stizaka. So let's go with that. So these are photographs of the workshop. Now, when I did the Woodlands project, I found it particularly useful to gain some of the insight that service users had from their experience. And I'm quite eager that this project ties in very directly with the experience of service users. So the Collage Workshop was a perfect way of gaining that. There you can see some of the croissants and fruit that I'm sure got collaged up, as well as the magazines. But some absolutely wonderful things come out of this. So, you know, some of the people here they could go to art school, quite frankly. They are artists, and others would profess to have not an artistic bone in their body, and yet they somehow engaged and made the most amazing things. We used a tearing and a process, and a strange process of using a very dry ballpoint pen to draw and trace round objects so that we could tear them out, and the results were quite astonishing. And you can see on the left-hand side here an image that somebody made that's very, very organized, and on the right-hand side very, very organized as well. So these were quite sort of technically accomplished pieces. And the thing that stuck in my mind here was this piece of work that contains the text "Be unique." I'm sure quite deliberately spelt in that way. So I came away from the workshop being very inspired by the flex and intuition and freedom that there was, and the energy that there was in that. And so no way was I going to go back to some sort of tight watercolors and drawings. So I set about using collage in the studios. That's the first thing that I did when I went back. I used a sort of a Olupu type approach to going to Oxfam and getting some cheap books. There was absolutely no decision making in it. They were just randomly picked. I really know nothing about football. I managed to pick a book about football, so that was a joy to cut up. But you can see a variety of other things. And so that's what I started with, the process of collage. And then I began to realize that what was fascinating me was the emptiness, the missing shape, which is hence the word lacuna, and this notion of something that is missing, a trace, of cutting, of shuffling, of reassembling, and gaps and overlaps. I like the idea of placing objects on objects as well in artwork. So just here's an earlier work which is called Translation after Christiane Baumgartner, which has a work from the collection placed over a wallpapered surface of a woodcut made in the style of Christiane Baumgartner. And here's some screen prints made with corn starch and corn carbon screen printing ink propped up with sticks. A previous work that I did for hospital rooms was at for the tribunal room at Woodlands, and here I'm using that pasting over the top, or placing a piece of artwork over the top, in this case over the top of text. So I took these images, photographed them, and translated them into what are called transparent positives that were placed onto silk screen, to be silk screen printed onto plywood panels. So you can see part of the process here. This is the result. So there's a combination of painting with acrylic paint and screen printing the imagery. So this is all derived from the collages. And the idea or the proposal was that that the work would be a combination of wall painted text. So I've taken the word "be" here from "be unique," and then these panels would be placed over the top using security fixings. So there's an element of scattered, of dislocated objects and images, a sort of dialogue and a game almost of translation. But rather than being paper, these will be the wooden panels. I've continued playing around with the idea on paper, and so hopefully this will still be part of the exhibition that Tim mentioned, when we can get a real gallery space rather than our virtual gallery space. So this informality and overlapping is probably going to be impossible with the plywood panels when we get to Northside House, but I think that it will still create this this kind of curious dialogue in an undidactic kind of way. And I really like the fact that the final position of this work is going to be next to the television screen and sitting area. I rather hope that it will create more of a diversion and distraction than your own reflection in the thick perspex that's in front of the television screen. Okay, thank you.
Thank you, Carl. And I believe you'll be installing that work in the third week of this month. So we'll look forward to that. Fingers crossed, yes. Finally, I'm very pleased to introduce Naomi Harwin, who's also a graduate of Norwich University of the Arts and a studio artist, or the studio artist at Wising Arts Centre in Cambridgeshire. Welcome, Naomi, and thank you.
Thanks, Simon. Thank you. And yeah, thank you for the invitation to speak today. It's been a really fantastic day of conversations and talk so far. And I was really excited to take part in the Northside project when Hospital Rooms got in contact with me. So thank you to the Hospital Rooms team as well. It's been a really insightful experience so far. I'm just going to share my screen with you guys. Great. So I thought I would start by just introducing my practice and the kind of work that I make, and then later speak a little bit about the workshop and what I'm thinking with the proposed work. So I work with elements of sculpture, drawing, photography, and more recently video to create installations. Broadly speaking, I'm also interested in ideas of relations, so the way in which two or more things are connected or have influence on the other. So that might be the relationship between ourselves, our bodies, and something outside of us, like an object, a space, or an event, or another body. Or it might be the observation of interactions between two things not connected directly to ourselves. And connected to this, I'm also interested in ideas surrounding perceptual encounters, particularly linked to parted relations, thinking about how a whole thing is made up of constituent parts, each with their own varying relationships and potential to function together and or separately. So my existing work predominantly has explored the world of objects, and these are forms that I tend to create myself. And I try and capture the essence of these objects by gathering information about them through various mediums, often starting with photographs and drawings. And then this information is translated and retranslated through new works, often shifting between 2D and 3D processes with particular focus on line, shape, and color. And these tend to be quite intuitive. And the results end up being sort of reductions and abstractions of the source object. So these are a few works created sort of November of 2019. And so once I create a body of work and a collection of works, I then tend to use methods of assemblage to interpret and reimagine and sort of re-articulate the relationships with these objects and the new parts created. And so around the time that Hospital Rooms got in contact, I was working on this exhibition. So this is Encounter, which opened about this time last year at Wising Arts Centre. And so what I wanted to do with this show was build on the processes of restaging that I'd already established and create more of an immersive space. It was based on a series of 3 objects and repurposed collaging techniques for a 3D environment. The structure of the space was slightly altered with additional walls that had been created from drawings of these objects. And then there was also a mural that covered the walls and also the floor. Within this were sculptural and photographic elements, as well as video and lighting interventions. And what I found particularly interesting about this work was the impact it had on the viewer, the atmosphere it created, and the sort of feelings and senses of sort of calm and increased curiosity, a slowing down and a desire to spend time with the work. So it felt much more like an experiential work compared to previous works that I'd created. So through this exhibition and in the past year, I've been particularly interested in ideas of space in a sort of relational manner. While I have been interested in this before in terms of sort of curation and placement, I became more so during this last year, considering methods of scenography and the role that it plays in a theatrical sense, but also in an everyday context. So how we are able to orient ourselves in relation to what is around us in the spaces and objects and also people, a little bit how Richard was touching on earlier. And how our attention is drawn to certain things and how we might then move through space as a result of those interactions with the body as a central connector. So these are the sorts of things I was quite interested to bring to this project. The potential for the environment to be created through assemblage elements, thinking about the use and movement through space in the unit, how the spaces in the unit was sort of used and engaged with. I've recently started reading a book by Anna Cooper Albright. Her background is dance and movement. The book, How to Land, Finding Ground in an Unstable World. She talks about falling in all senses of the word and disorientation, and the way we might combat that through creating and reinforcing a sense of grounding. And that feels particularly poignant right now where we are globally, but also sort of felt like it had connections to the service users and also to House, and thought, you know, there were particularly interesting moments within that book. She uses movement activities as a way of counteracting some of the behaviours that are installed in us at the moment in terms of disorientation. But I thought I'd mention an example that she spoke about. So reconnecting with our peripheral vision and awareness of, and noticing what is happening on the edges of our experience, in broadening our perception and drawing attention to, or focusing our attention away from our central focus, creates a fuller and more dynamic presence within a space. So I thought that was quite interesting. Moving forwards, that creates a more embodied experience, I would think. So these are some of the things I wanted to bring to the project. The possibility to consider the space as a way of counteracting maybe a feeling of being off balance, perhaps. So yeah, those are sort of elements I'd like to sort of bring to this project, with ideas of sort of stability, creating a sense of grounding and balance, reframing the space, and creating sort of anchoring points. So I managed to visit Northside House in December, and so the workshop that I created and worked through with the service users and the staff was a 3D environment sort of building workshop with simple processes of paper and folding mechanisms. So I wanted to use quite a simple process that allowed us to explore how slight interventions can transform something 2D into something sculptural and architectural. And it was really great to see that there was I didn't need to have too much of an input. They had a lot of ideas, and the creativity was just sort of flowing without too many sort of interventions or guidance. And so there was a real variety of outcomes, a mixture of responses, working on representational constructions based on hobbies or interests or spaces they had strong connections to. So we had we had a boxing ring, there was a festival, there was also a playground, while at the same time there were some more intuitive responses, working and responding to the paper and the colours in a sort of abstract and ambiguous way, so the spaces they created. And so, yeah, these are a few more examples. We also managed to explore light and how that impacted the structure and cast shadows, and how that changed the interactions between the different elements. So that was a really interesting element as well that we were able to add in sort of at the end. Throughout this, it was really fantastic having conversations with the service users and understanding their experience within the units, the spaces that they enjoyed being in, or how they felt moving through the space was for them as a service user. A lot of them also had a very creative background, like Carl mentioned earlier. A lot of them could, be studying at art school. They have a lot of creativity going on. And what I noticed was there was also a lot of energy and playfulness. And so I really want to bring that to the commission. So like I mentioned, I got to visit Northside House in December. So along with the workshop, we also got a tour of the units, and that was really informative. I was most interested in some of the sort of social spaces, particularly the TV room, but then also sort of transitional spaces like the corridors. So this is a draft of the mural element of my proposal. And so this is a combination of shapes extracted from the constructions made during the workshop. And so what I'd really like to do is create a space that has that playfulness and energy that was in those constructions, but also has some kind of feeling of grounding, a grounding element to it. So this painting will wrap around the space across the ceiling as well. And then amongst this, I would like to create some sort of relief in the sense of layers. So within this setup, there will be shaped wooden painted shapes attached to the walls as well, across the ceiling and on the walls, as a way of altering that space a little bit, so it also engages with the sort of physicality of the sort of architecture of the space. And then within that will be simple line drawings based on some of the shapes and structures found within that workshop. So it will be quite a sort of a mixture and layered artwork, but hopefully sort of brings across that playfulness and energy that I could see sort of in the work of the service users, but also provides that opportunity to sit and feel a response to the space that they're in. So there's a few drawing elements here, and then some photographic things I've been playing with recently, using the photographs from the workshop. So it's really exciting to sort of be able to put together a design based on a lived space. So this has been a really fantastic sort of opportunity to play with how to best create something that will be used on a regular basis. So that's me. Thank you very much for listening.
Thank you, Naomi. That's great. And one of the things I think is interesting, perhaps, to discuss in our next session is the location of the work and how that's kind of part of the interaction between staff and students at Northside House, and as a kind of co-production dimension of how hospital rooms works. So we're now going to convene our second discussion panel of questions. This is the point in a normal conference or research symposium that we all shuffle around and get into the front of the audience, but we don't need to do that. If you could join us again, and Phoebe and Tim and other panel members this morning, please do join us for some of the questions that have been coming through the Q&A. I think perhaps we might maybe start with that experience of the workshops. I know that Cara and Carl and Naomi have done their workshops. Jade said she's doing hers next week. And Richard, I'm not sure if you did a workshop when you for the work you did at Hellingly, but it's the role, the importance of those workshops, the significance of them in the kind of co-production dimension of the hospital room's way of working within these units, and also, as I just mentioned, the location of the works, and the negotiations and discussions around what areas of the unit work can be cited in, and what's best, how you've been involved with service users and staff about deciding where the work should go. So maybe we could start with that question first. Anyone?
I can say something.
Please do.
But that's just because I'm a bit mouthy. Well, my point about architecture with a small a, and magnolia. I mean, I'm a sloven in my own life, not because I mean to be, but because I'm just like that. Somebody else made a joke about being untidy, and I think that the thing that was so overwhelming to me was institutional tidiness, and of course I have my own childhood experiences of these things, and you witness forms of tidiness all over the place, and you also know why they exist. They're part of, if to quote Paxman, if everybody threw everything around all the time, we would be in a perpetual mire of all the dross that we are surrounded by, blah, blah, blah. But I realized that what was so difficult was, how do you interfere with that in a productive way? And I thought that what I should do would be to somehow whisper, to do something quite, a word I like very much, surreptitious. But none of that would have been possible without a near party atmosphere. I don't want to exaggerate it, but an incredible openness that the people at Hellingly offered, that Tim and Neve brokered. And I'm somebody who, I think I'm at a point in my life where I don't mind that I don't know. I mean, I think I travel out of ignorance most of the time. And a lot of what's happened today, I realize how little I know about this or that, although dozens of things have been mentioned I know a bit about, but I couldn't join them up that eloquently. And I think that when we did the workshop, I didn't know what to do, but I don't throw away newspapers, and I happen to have some newspapers in the studio. And I don't throw them away because I think they are history. And I think history means you weren't there. History is just this really odd place that we're all in all the time, but we're not in at all. And I picked up this suitcase, an old suitcase, which I didn't realize was broken. That's why it was in the studio. Put the newspapers in it and met them at the railway station. And they were nothing but nice. And those newspapers, the sort of irresponsibility of my act, or the anxiety of my act, was somehow propelled into the workshop. And the workshop was incredibly vigorous. And I loved that description earlier of cutting by marking with a biro. I mean, we do these things every day anyway. You can't find the scissors, you fold the paper. I'm not sure that helps you start what you want to talk about, but.
Thank you. Carl, what about the location of your work on Naomi or Cara, how the work was kind of cited? And perhaps Jade as well, I'm not sure if you're at that stage yet with your piece or not for this project. let's not be English about this. Let's just come in and speak.
It might be good to also talk about, because there's 3 different wards in Northside House, and it's everyone's work is in a particular ward, because that it's kind of an amazing, like the architecture is quite an amazing space for work to happen, because it's got this huge communal area with lots of light, and then these little rooms that are offshoots that Cara and Naomi might work with. So it might be good also talking for Jed to also bring in the perspective of why Catton Ward was seen as sort of the site for those things to happen. And then I guess maybe Cara as well with your work, and as you said, like the window being so central and those sort of elements, and how that sort of changes the work, because obviously everything is site specific, so the work's going to evolve around the spaces.
Should I say a little bit about what we call Catton Ward? When I sort of rolled into town like 18 months ago, when I should have been on tour with a rock band, but I found myself at Northside House. It's a little bit unscientific really, but walking onto Catton Ward, which was a very, very sort of busy ward, a lot of acuity, a lot of uncertainty. There was a real sense of feeling unsafe. Architecturally, it's a fascinating area, but the ambience wasn't right.
I'll call you back.
The ambience wasn't it wasn't right. There was something unsafe about the place, and you know, I think we were all struck at how bland it was. Several people, and Richard mentioned Magnolia. You know, it was bland. It was soulless, and I think that really added to this uncertainty, this sense of anxiety, this hollowness. There's no soul there at all, and that's the newest part of this place. And then, of course, there's another part of this place which was constructed maybe 30 odd years ago, which with low ceilings, dark colours, very oppressive. And then another area similar to Catton Ward, a complete sort of blank space. And, you know, it begs the question, what's the identity? What's the purpose? Where's the opportunity? Where's the hope? And I guess what's been fascinating, the reaction, it sort of overlaps with the previous question really, is this is all about relationships. It's about people and relationships, regardless of histories. But the relationships are everything, and the relationship to the space that people are living in, and what they're allowed to do with that space as well. And so, as we've walked around, as the workshops have developed, people have developed this sense of independence, an opportunity to express ideas and to talk about the areas that they live in. And if we are able to transform these areas into something with a bit of meaning, a bit of identity, then recovery it's an obvious follow-on. Recovery starts to happen. People function in a different way. Staff function in a different way. We don't see the process. We feel more about what we're doing, and we see human beings and what they're capable of, rather than this sort of warehousing process that we get lost in. There's been a lot of talk today about institutional life. It's a fascinating thing for me. It's something I don't like, and yet I've been there forever. But the sense of uncertainty was all around, not knowing where you go and when you're going to get there. But suddenly we have an opportunity to use this space creatively and think about it, and to have total involvement, and it's a gift. It's a gift, and that everybody's able to participate in. So that's probably not answered anything that you've just raised there, Simon. But I don't know, Phoebe, what you think. But for me, it's this huge blank canvas. More importantly, what's the identity? What's the soul? What is all this about? What's the purpose of it? And I think people suddenly realize that they're not just patients going through a lengthy process. They're people who are inquisitive, who have a lot to offer, a lot of ideas, people that, you couldn't anticipate the response from some of these guys who have a real interest in architecture, or have really strong opinions on what art is. And that's what we've seen through the workshops. It's been an absolute joy. I'd rather be here than on tour with a rock and roll band any day. With the artists and hospital rooms, it's a gift and a privilege.
Wow. Thanks, Jed. I'd like to move on to some of the range of issues that particularly Clive and Jade raised, and specifically around the relationship between human rights and mental health patient care is one I'd like to raise. That is the contradiction between human rights legislation and some aspects of patient care and control, and how these are indicative of broader forms of control, if I'm reading some of what Clive and Jade were talking about. So I don't know if Niamh and Tim, if you've got any thoughts on your experience of that within the various units that you've worked in, and Clive, Jade and Jed, particularly if you've got any thoughts on that clash, that contradiction between human rights and mental health.
Well, can I just sort of jump in and say, in case I don't get a chance to say it later, it's been brilliant. And as the day's gone on, I've been writing people's names down. Oh my God, that's the best. Oh my God, that's the best. And Jade, I've got to say, I don't want to put you on the spot, but everybody's the best. But Jade's personal story and that thing about perception of, the authorities clamping down on an individual with human rights was a very poignant moment for me. And I don't know if there's any way you can address what Simon's been asking Jade any more than you have done in your profound and beautiful story, but it said so much more than I can contrive to say in a presentation like mine. You know what I mean? It was real and authentic and sharp and blistering, and threw so many questions in the air about what's real, what's truth, what's lies, who governs who we are with our bodies, who governs we are with our mind. We talk about parity between physical health and mental health, but we see everything falls down in that kind of situation.
Thank you, Clive. Thank you so much for your words. I maybe can follow on around also feeding into your previous question about where the work might be cited. And I think that we're considering Catton Ward, and we've discussed placing imagery that would be put onto another surface, an equivalent to vinyl, something sustainable, that could be put on the wall or the ceiling. But from my experience, I was particularly struck by my raising the issue of the space that I found myself. I understand that for precautions. Rooms need to be locked and windows aren't allowed to be opened, and those aspects of being confined in response to somebody or an institution bestowing what is thought to be care on somebody like me. But it was striking. I'm pleased that the Magnolia issue has come up, and these sort of the sterility, I suppose, is all part and parcel of institutions that require regulation or routine and all of that. But my sense is that that space that I was in for 6 hours was not generative in any way for either the people that were doing the confining or for myself. And we had discussions around that, but I also want to add that because I've been educated in a certain way and I'm articulate, that at one end, it alienates, say, the police officers because I sound facetious or as though I'm undermining authority, and that has a bearing on human rights. And on the other end of that spectrum, within the institution, the facility, the people who were keeping me, holding me there, were also agreeing with my observations. So I suppose that were the questions around human rights and how maybe mental health facilities can query what our human rights are, has something to do with our ability to voice our own individual concerns. And then for someone like me, it's the privilege also of being able to then make work from it. I have that privilege of being able to create from that. And that's not available to everybody. So I don't know whether I've answered a question. I've just said words following on from Clive, but thank you.
Okay, thank you. Anyone else want to come in on that? We've got a number of other questions, some of which were carried forward from the first session. We may not be able to answer them all. You know, questions are not necessarily answered; they're responded to. So that's fine. Richard's got a finger up.
Very, very quick. I love that Jade apologized and said, "Oh, they're just words." I would suggest that somebody goes through everything that's been said since we began this morning and just takes out these words that, I mean, they're just brilliant, the words. Soothing, magnolia. There's an incredible life in the language that everybody's using. And somebody pointed out to me, I was a bit ashamed to have it pointed out at my age, but the Anglo-Saxon, English is this mush language, and the Anglo-Saxon is how we feel, and the Latin is how we construct. And you can test it on nearly anything you say. It's quite shocking. And it doesn't matter whether you're educated or not, and you know what the difference is. You'll soon notice that the short, sharp ones are Anglo-Saxon. But I want to applaud Jade. I think that she's very articulate.
Thank you.
A Latin word.
Actually, I think it was Mark Vonnegut Kurt Vonnegut's son has written quite eloquently on his experiences of breakdown. And one of the things he said was that in some cases, mental illness is a reasonable reaction to an unreasonable and unfair society. He talked about, clearly for him, although not for Vonnegut himself, quite a lot of Vonnegut's work came out of post-traumatic stress disorder as a result of his experiencing the firebombing, or not experiencing the firebombing, and experiencing the outcome of the British firebombing of Dresden in the Second World War. So we've got a number of other questions, some specific ones for Tim and Neve, but please everyone respond to this, because you've all collaborated in a number of different ways. And if I can find the question. So there's a question about how much co-production, Holly, how much co-production and co-creation happens on the project, but also what Tim and Neve particularly think that are the ingredients. I found it. What are the ingredients do they think make a successful collaboration in the hospital room setting? So that's for Tim and Neve particularly, but I'm sure you all have got experience that you can contribute to those questions.
I guess we're still figuring that out, but I think something that's we can all become quite used to the way things are. And what's impressive about Jed, for example, is he's worked in the prison system and in mental health units for decades, but didn't walk back into Catton Ward and say, this is okay. And I think it's quite good to bring in all these artists, because, you know, whether you've experienced those units or not, you go in with a fresh pair of eyes, and it's easier to criticize that environment and the way things are. And I think it's important to say that as well, because there's lots of really brilliant staff at Northside that aren't improving the spaces because they haven't got the time, and they're trying to do a really good job for all the people there. So it's much easier for us to come in as outsiders and say there's something really wrong here and we're going to do something specific about it. But saying that, the biggest thing is to have these conversations. We found that when we did our first ever project, we did the workshops at the end, almost to kind of contextualize the artworks and say, this is what the artist has done, now we can talk about it, almost like a kind of, but we'll do a bit of an activity at the same time. Whereas we quickly realized that was important that it happened at the beginning, because once you say, like I said before, once you ask people, well, what do you want to see here? They'll say something calming, or a tree, or a landscape. And what we don't want to do is come in and just do the 6 artists that we all want to do a landscape. And the workshops and the conversations and these, sadly, we don't do these kind of evening gatherings in person anymore, but all those opportunities for people to not have an efficient conversation about what we're doing are really useful. It's those kind of little in-between conversations that the artist can go away with, and you know, Carl might have spoken to someone, and there's just something they said that they didn't mean to say that actually really influenced where his work would go and what he's going to make. And I think the other thing is all that leads to something that's not patronizing, and sometimes it could, with all the best intentions, because something is done to the environment that's very sort of quick and that's been seen before, it could be quite infantilizing and patronizing. And I think a longer term in-person conversation can kind of get around that. And we've worked with this really amazing illustrator who spent a lot of time as an inpatient, who one of her brilliant drawings she did for us was of a live, laugh, love poster, and her reaction was yuck, yuck, yuck. And I think that was put up by someone who really meant that to be a nice thing for the people there. But I think our process is just about trying to find ways that we don't have to be too efficient about bringing people together.
And then just to add a tiny bit to that, I think it's about warmth. It's about putting yourself into the shoes of each different participant in our projects. And, we think so carefully about the fact that, and this is something we've learned, that the mental health system destabilizes people's sense of self to the point where they don't know if they can pick up a pencil, or, you know, that requires some confidence to create something. So that moment that someone has built themselves up to open a door into a workshop, and I've seen it in people's eyes, and they go, oh, I shouldn't have done it. I don't want to cross this threshold. And it's our ability to draw somebody in and say, you don't have to do anything, just sit with us, just have a cup of tea, have a little moment to see what we're trying to achieve here, and please contribute if you feel able to. And we do that in so many ways. We try and make it visually appealing, like we bring the artist's books and examples of works to make the activity room look different, look like a studio. We bring tea and coffee and cake, and we look people in the eye, and we shake people's hands, and we just put that relationship at the center of everything. It doesn't matter how long it takes, or if we have to find rooms where we only work with women at one time and men at another time, or if we have to repeat a workshop 3 times because we need to work with one person one-on-one, or we need to consider all these different scenarios that might happen. But when you put all of that into play, suddenly, like, you get back 100-fold, because you get people's imagination and ideas and openness coming in and feeding into artists' works who are already more than capable of interpreting and conveying some of that and all of those things. So I think that hospitality and that warmth and that heart hospital rooms doesn't exist if that doesn't exist. And it doesn't matter if an artwork is, you know, the smallest little thing in a corner or massive projected film. It doesn't matter. It's the process and it's the connection.
And I also think that the sense of sort of collectivity and collaboration comes from it not being on the individual. We're kind of looking back on the institution or the environment or whatever, and everyone's doing that together. So it's almost this sort of form of, or what they call in the 60s, institutional psychotherapy. You're sort of taking the emphasis away from, you know, what Clive sort of spoke about pathologizing the individual, and instead you're sort of pathologizing the institution. You're sort of reversing that or turning it upside down. And I think that's something that just generates collectivity as well.
Great. Does anybody else want to speak? Clive.
Just really quickly, and something that Tim and Neve exude really, and Richard touched on it before, is, in my language, interpersonal skills. And I think whoever's like negotiating this stuff, making this stuff happen, because it can't always be the artist. Not all artists have interpersonal skills at all. But to have those skills to navigate, that it harks back a little bit to the R.D. Laing film I showed. It's about getting people to listen and then listen harder, you know, the authorities. It's about speaking different languages, because, you know, the language of the NHS is fundamentally different to the language of artists and creatives, or whatever we're going to describe these people as. So yeah, I think having interpersonal skills, I'd say, put it at the top of your ingredients list for the people who are kind of managing and negotiating that thing to make it happen in such a beautiful and sublime way.
Thank you. I wanted to come into a point that Annabelle has made, and she says she's a current junior doctor, passionate in learning more about the field of arts and health, wishing to promote it further in all areas of clinical practice, inspired by the projects. She wanted to ask how often are medical professionals, particularly doctors, involved in the projects, and whether this is an area that could grow, involving a multidisciplinary approach to improving patient care and experience, which I think we're all kind of invested in. Tim, Neve, maybe you could say how much are, obviously medical professionals are involved, because Neve, we've seen Neve and Sue and others and the staff. Are the psychiatrists and doctors involved in hospital rooms projects actively?
Yeah, absolutely. I mean, because of the kind of settings that we work in, it couldn't happen without real collaboration with clinicians. Basically, you wouldn't be allowed in the door. It doesn't really matter who it is. It could be an occupational therapist, it could be the psychiatrist, it could be a psychologist. There's lots of different types of clinicians who engage with us and invite us to come, they just need that spark, you know, and they need to have that slight rebelliousness and determination to do that kind of negotiation of all the different reasons why you can't do these things to get us in. And there's also, you know, when that collaboration is really good and there's a lot of synergy between our team and the clinical team and residents, you know, then it's really joyous because you can really try things that seem a bit radical or a bit risky, but really aren't, you know, that I think there's a lot of received wisdom and a lot of inherited wisdom where, you know, oh my God, you know, people will destroy this or this will break, or, you know, obviously we work with clinicians to make sure things are safe. But I also think that there's a kind of respect that we have to give to people and a kind of trust that you can have both ways. And you need professionals who are willing to, you know, put their kind of neck on the line a little bit in a very blame and risk averse culture. So I think you need clinicians who, you know, obviously give us the advice that we need, but you also need, you know, the Jeds who will take a risk and who will, you know, stick their neck out.
But like the success of a project sometimes comes down to how many and how involved the staff are. And we'd be lying if we said that all the projects were as successful as each other. I think all of them have been successful and interesting. We've learned from them, but there's, you know, when we worked with Hellingway Centre, when we did the evening gathering, there were 40 something people there, and there were parents of patients, and you know, Richard, you were there, and it was quite an amazing evening. But we have done an evening gathering at a unit where 2 staff members came, and we had 6 artists there and the team, and it did basically end up being a more risky project as well. And you know, so basically it's so important having the psychiatrists and the OTs and everyone involved and wanting it to happen.
Otherwise it's like dragging everyone along with you.
And even things like getting onto the unit feels like, you know, crossing a border at wartime. You know, it's kind of just getting into the unit every day is incredibly tricky. And then when you're on site, you don't know if everyone's going to be safe. You know, you're not involved in what's going on in the unit. So it is important, but it's not always a luxury that it's like it is at Northside or Hellingway Centre.
Yeah. I was just going to jump in and say that my experience of both Northside and Woodlands was, I was astonished at how incredibly enthusiastic absolutely everyone was, and how proud everyone was that that hospital rooms were in and that something was going to happen. So, you know, that's been my experience of those 2 projects, a universal approval of what's happening.
Thank you, Clive. Richard.
Just 2 silly little things which on a train ride with Tim and Eve would come up. Hospital and hotel are the same words. You can check it out. And it's very relevant to a lot of things that have happened in the last year. But the other thing that I think really is to do with that social skills point is that Tim and Eve really understand. I mean, we've all seen the rubber stamp which says confidential, and I'm of the disposition that if it says confidential, I definitely want to read it, and I'll probably tell somebody else what's in it, not because I'm a mischief maker, but because I realize that it probably means you should know that you're with somebody with a wooden leg or whatever. These are really quite refined spaces. So there's a strange connection between to confide and confidence. And I would say that Tim and Neve really know that. And I think that has to be a kind of baseline of how you make confidence. Because if you can speak as frankly as a lot of people are speaking now, then, I mean, clearly that's a privilege. We're in a privileged space, but it's incredibly generative and creative.
Okay, thank you. There was, both Maggie and Lucy have made the point that what we've been talking about resonates with the work of a group called A Disorder for Everyone, AD4E, and the value of that, and encouraging people to check that out if you haven't seen that on the comments Q&As. Beckham asked the question, how might artists be more embedded into the structure of care and health in the UK? There must be a role for the arts and creative professionals in prevention as well as recovery, and I think that's really important. She'd be interested to hear your thoughts on this. There's a very valuable, I think, project in Cambridge, just trying to remember the group who runs it, where young people who go to GPs with anxiety issues, with stress issues, are referred by the GPs to this group for art workshops before, if the GPs feel it's appropriate, before they're given pills and other forms of therapy. And I understand that's been, really very, very successful. So I think those prevention mechanisms and art professionals being involved in those is a really valuable way forward. Clive.
It's just a really quick one, and it in part addresses that, but also one of the questions this morning about how do you affect the NHS? How do you get people to listen? How do we transform the culture of health and well-being, for all sectors of society? And just two really useful points, the points of reference for people to sort of connect in with. One is yesterday there was the launch of the National Centre for Creative Health, which has in its remit a real focus on the NHS and strategy and how you will make those changes, especially because they're on the knees and they need to do something different. So there is an evolution going on there. That's one thing. And there's the Culture, Health and Wellbeing Alliance, which I guess, if I'm being honest, focuses more towards the art and artists. But both those organisations are national, and both of them are committed to supporting and responding to people's needs, whether you're from a medical background or whether you're using services at the moment, and every single person in between. So it's up to us to sort of get in touch with those organisations and be part of them and push for changes, because the NHS is in a weird state at the moment. It's rolling out social prescribing, what you were just really describing before, which is great in so many ways, but if it dumbs everything down to a sort of prescription and you get to do that for 3 weeks and it's individualistic, there are issues there. And I've said a number of times, it's often been described by Matt Hancock as a free social cure. Artists aren't free, there are no such things as cures. It's far more holistic than that.
Absolutely.
It's an interesting thought that you could go back to the artist placement group, to Barbara Stavini and John Latham, and think, well, they were arguing that in the 70s, that artists should work in every profession and not least healthcare, and that it should become embedded in kind of intrinsically embedded.
One of the artist placement group was actually placed in Rampton Hospital, which is one of the high secure unit, like Broadmoor, Ian Breakwell, and then he did a film called The Institution about that. So it's all interconnected.
Yeah. I also think there's a role for community intervention. It's not just about artists. There's a need for a broad response to the current kind of health and social crisis, and community intervention is also, can have a role in that. I don't know if you heard there was something on Radio 4 earlier this week that talked about the friendship benches that have been introduced in Zimbabwe, and as a community intervention, because there's so few psychiatrists working in the country, that they decided to, one particular psychiatrist decided to use the power and sagacity, wisdom of grandmothers in society, and to train give the grandmothers a month of training in CBT, and then introduce benches into towns and villages. I'm sure you know about this, but that kind of community intervention is, really, I think, also really valuable as a way forward. Use the experience, the knowledge, the support there could be in the community for people who are having, problems with their mental health before they get, acute and need other forms of care. I must ask you all a question from Ben, who asked it earlier and I couldn't squeeze it in. And it makes a very interesting point. He said, I work in video production and TV and cross-funded work in video arts. The aim is now to see this support recovery post-COVID in a number of contexts. There are some advantages included in this is flexible and content can be curated by clients, etc. Authoring can also be collaborative in tech-enabled ways. Have the panel any views on these forms of context for health and care and well-being? How would evaluation be affected? Kind of using video production as well. Don't think has there been a video made in a hospital rooms project yet, or co-production in hospital rooms yet? Tim?
We've got the Sophie Clements video installation, and we've done some video workshops where it's been a big collaborative artwork with video artists or filmmakers. And it's something we want to do a lot more of. I think just physically, it's a more difficult thing because in the units we work in, obviously everything has to be really compliant. You can't have a screw sticking out of the wall. You can't have ligature points. Everything has to be kind of scrub clean. But also, even if you find a place to have a projector or have a screen, it has to be able to be turned on every day. So you need or it needs to be on permanently. So there's a lot of things, and you don't want to do a whole piece for it just not to exist, or for it to be turned on once a year when we come back, or to make us feel good about it. So the Helling Eye Centre, who we talked about a lot, we knew that it would be turned on every day. We get a phone call when the bulb gets burnt out after a year, and we could go and get a new bulb put in. But I mean, definitely. And I think, we do a lot of work that's kind of flat to the wall, but it's something that we want to, we want to do new things. And I think we want to do a lot more with digital, a lot more with video work and all that kind of thing. Phoebe, I don't know if you're going to say something as well.
Because I was just going to say that we've almost done both of those things, co-production and video, in one artwork with Sophie Clements. So, yeah.
Fantastic. Okay, well, I have to confess I've been struggling with the anxiety of the institutional part of myself, in that we've running over time, and so like to thank you all as speakers, thank all the questioners, thanks to everyone attending the symposium. We're so pleased that so many of you could join us today, and I hope it's been as fascinating and stimulating for you as it has been for me. Thanks for all your questions and comments and sharing of experiences and links in the Q&A section of the Zoom webinar. I'd like to particularly thank Tim and Niamh for bringing us all together and setting this up through hospital rooms. And finally, I'd like to thank Hannah Bedford, who's the research administrator at Newer. Hannah in particular is the key person organising the symposium and making sure that it's worked. Thank you, Hannah, as well. We will have a series of online research seminars and future research conferences and symposia, and I hope you can all join us at those as well. Keep well, everybody, and goodbye.